Hi, friends. Good evening, everyone, and good evening from India. I'm Ankit, your host from Delhi, India, and we have two wonderful people. Willie is joining us from down under Australia. Hi, Willie. Namaste. How are you doing?
I'm good, thank you. I'm good.
And we have Kimberly Calhoun joining us from North Carolina, United States of America. Hi, Kimberly. How are you?
Namaste and good evening to you, Ankit. And good early morning to you, Willie. And you two have been up quite a lot already. What a beautiful day we have today. Although I'm snuggled into my attic area where I was yesterday when we were playing Chess Stars, which was quite
Yeah.
interesting. What did you think, Ankit?
So it was the interesting game. I didn't watch the second game. So who won the second game? Because first game was draw.
Robert?
Oh, Robert won the second game.
Yeah, I think so. Yeah. So you remember I got confused and I thought the game was over the second time
Yeah.
and we started
Yeah.
talking and I cut it off. And I
Yeah.
had no idea the game was still going.
Okay.
And oops, and then we pulled it back on. And so a little confusion. Had a long talk with Michael afterwards and he laughed really hard and thanked us for all of our hard work. He was frustrated too. I think everybody's a little on the frustrated side because we're all been locked in. We don't have our jobs. We don't have our money. He's one of the unfortunate ones who have fallen in the cracks with the stimulus programs. And so I told him to go talk to Nick and Max. Remember, Nick and Max said, if you don't get your stimulus, what did they say? Call us. So that's what I want to tell people is that, if you're frustrated, contact us. Don't be frustrated. I think one of the things I enjoyed last week about some of our conversations is maybe talking about getting some psychologists on the phone to speak with people who are at home, alone, frustrated, maybe are in pain and cannot receive their treatments. And I think this is going to be good. Something else I learned yesterday was just a fabulous show with two doctors that were just absolute. What did you think, Willie? I was blown away.
That was amazing. I was really inspired by that. Really inspired. And the diverse of viewpoints. Yes, they both medical doctors, but they presented two totally different perspectives on the same topic. That
and
was
didn't
amazing.
argue and hate each other.
No,
No, they
no.
respected each other. Oh my gosh! So it wasn't, well, golly gee, I'll no, it was, let's send each other a life float here and understand, wow, that's interesting. I never looked at it that way, or we don't do it that way. This is,
So they
wow.
were very calm. I mean, they were very calm and sorted. I mean, and they were waiting for each other's turn and also listening to the other person carefully so that they have some points to discuss and showcase and maybe also appreciate each other's work as well. And I got a lot of calls and a lot of people were also messaging on social media that it was a wonderful conversation and they learned a lot of things about dialysis. And also, they would love to see the doctors back again discussing more things about the kidney and nephrology and how the life cycle works for the nephro patient. So it was a beautiful conversation and very, very informative. And I would seriously thankful to all the doctors uh, for taking the time out and doing all these things for us on IBM TV. And it was really commendable. And we are expecting more doctors in coming week. Maybe today also, I'm expecting a couple of more doctors joining us. So let's see how it goes.
Good.
So how is the situation?
Go ahead.
So Willie, how's the situation in Australia?
Good. Like I'm just looking at the data. I've got like 2, 4, 6, 8, 16. It's over 2 weeks now, and it's kind of flatlined. Like I've been saying, the beginning of the flat line, and the total that we have that have passed away is 70 in the
That's
whole
it?
of Australia.
70,
70. Yeah,
17 or 7D?
70.
That's it.
Yep.
That's
Yep.
it.
Yep.
How many infected total?
Total infected is 6606. 6,606.
Oh,
That's so something that Australia did, we need to pay attention to. I mean, this is very important information and very important data and facts. Even though you had a lot of frustration with a lot of people not wanting to adhere to the strict restrictions, but restricting people and fining people and keeping people at home made a big difference.
It has. It has. It has. And one of the things that, I mean, they're still doing it. We're still in the restrictions now. And they're talking about open with the school year, and they've extended. So I see that as a good thing. I see that as a very good thing. Yet some of the places have flatlined, like Northern Territory. Their stats have been like consistent. 27 for the last week at least.
So, I mean, are you doing a lot of testings, or I mean, it's just that you are able to stop the spread of the virus across Australia? What are the practices?
The testing is happening, but also the restrictions, the lockdown, and clampdown. Only essential work is permitted.
Okay.
And the police are sort of stopping. Okay, what's your excuse for being on the road today? People in the parks. How come you're on the road? I mean, they don't harass you, but they just have an explanation. So I see that as a good thing. I see that as really
okay. Because so how many testing have been done so far? I mean, do you have any numbers on the testing done in Australia?
No, I don't have any numbers on the testing. I'm just going off the data that has been like the amount that's been tested around.
Okay. And what's the hotspots in Australia right now?
6606 confirmed infected.
No hotspot. Is there any particular hotspot that
New South Wales, Sydney has,
Any particular area of Sydney? I mean, or the whole of Sydney? How?
Just Sydney. That's,
okay.
New South Wales, but Sydney's the one that's been mainly affected.
So once you reopen the lockdown, Sydney will also be open for work, or you are taking time to open Sydney?
They're going to take time to open up. They're going to open up a rollout.
Okay.
In stages, come out in stages. So I see that as expect. I saw there was a thread because I'm originally from Fiji, and I saw a thread that Fiji is going to go back to normal next week.
Yeah.
And the schools are going to open up again. And some of the people were complaining that the teachers don't have the teachers are going to go back, but the parents are supposed to go to the schools, pick up the paperwork and bring it home. And some of the people are complaining that the teachers don't have PPE. Okay. So I said, easily solved. The schools that do have PPE, open. The schools that don't have PPE, close until we get the PPE. But it was very much a lot of finger pointing and things like that. I said, okay, you don't fix the problem. You just still pointing fingers. I know, get over the pointing fingers, but find a solution.
Exactly.
The head of my topic was test, operate, test, exit. You test, it works, you get on, move to the next step. If it doesn't work, you go back and test again.
Yeah. But when you talk about PPE, you mean to say, students and teachers will be wearing the PPE kits in the school? Is that what you want to say?
No. Just the teachers to have and the parents. So if the work is going to be handed out at the school, somebody should be like at the gate if the parents don't have any PPE as they're traveling around, if they don't have PPE.
But do you think the online education is a much better option rather than calling students in schools? And
no, the students are not in school. The students are at home. The parents are going to the school to pick up the work to bring home.
Okay.
Yeah.
That's what I mean. So we just wanted to make So basically, parents will be coming to school to pick up the work for their children
and bring it home.
To follow that protocol, we have to have a PPE kit and all those gear equipments ready.
Because of the interaction, yes.
Yeah, we are following the precautions. Okay,
yeah.
That's good. Because what's happened in India, I think from grade 1 to not grade 1, maybe from kindergarten to grade 12th, most of the schools, 99% of the schools are doing online education. So they are
Okay.
sharing videos, they are putting everything on website, and they have online lectures. And if you have any doubts, you can ask to the teacher. So things like that. So we have a
Yeah.
schedule for a different timetable for online and different timetable for the regular classes. So that's what's happening in India.
Good, good. Yeah, Australia is running the same thing. I've met a few teachers, and they sort of just going through their school plan of
Yeah.
what they're doing, because the different teachers come on at different times. So, and they submit, okay, this is your textbook, open up, and this is the work that you're going to submit. Let's do the work on this page. Any questions? Anybody got any questions? And they have a chat about the different questions that's happening. Yeah,
Okay.
it's quite interesting.
That should be a start basically, so that people, I mean, students would get ample of time to study with. And if you
Mm-hmm.
don't have, but I think we need a revolution on the online education as well, because that looks like the next big thing, and because a lot of institutions around the world still not online compatible. And I
Yep.
mean, also I was reading an article and was discussing with a lot of people in who works with different laptop companies. So what happened is that if you check a household, they have around two or three, maybe four laptops. But now you need one laptop for one person to go through all those studies and all those things, because that's how, I mean, the life looks like as at this point of time. So
Yep.
so
Yep.
so what happened is that there are a lot of family where like two kids and two parents, and they have around two laptops plus one backup. Now the both the parents wants to do work from home, so they are working. Their children wants to study online, so they are also studying, but they don't have laptops.
Yep.
And in lockdown, it's difficult. And also for a parent who is working, it's difficult for them to I mean, manage their children, because whatever the online works comes in, these are, I mean, a parent should be monitoring those work till the time the student is not a teenager. So it's a difficult period for parents as well, but
Yep.
that's
Yep.
how the
Yep.
life is. And I think
Yep.
we have a special guest, Dr. Jatin Ahuja, with us, and he's the COVID specialist from Max Saket. Good evening, Dr. Jatin.
Namaste.
Namaste.
Good
Yeah,
So,
evening.
thank you very
can
much, Ankit, for the introduction.
Thank you,
Hello.
sir. Thank you. Can you
Am I-
introduce yourself? So we have Kimberly joining us from North Carolina, USA, and Will is from Australia, and we
Yeah.
are
Hello.
the United World. So we would expect a lot of insight from you,
So, Dr.
Yeah, sure.
Jane, do I say Sabu well here?
Dr. Sahab.
Sahab. Okay, Dr. Sahab. And Rakesh, good morning. Hi.
Hi,
Um,
Rakesh.
explain to us a little bit about yourself, for the viewers this morning, and your background.
Dr. Jatin, can you able to hear us?
Its voice has been cut initially. Hello.
Yeah. So
Hello, can you
can
please
you
come again? Yeah.
tell yourself what do you do and where are you from, so that our viewers would be knowing what you do and what you where are you from, and how you are working during this COVID thing?
So actually, I am an infectious disease specialist, and I just did my DM in fellowship in infectious disease around few months back from All India Institute of Medical Sciences, New Delhi, and currently I am working with the Max Super Specialty Hospital and one more hospital in the New Delhi area. So my core interest is in the transplant infections and the tropical infections. And since I'm being an infectious disease specialist in the COVID pandemic time, I'm giving my time to these COVID patients also. So these are the patients who needs early detection by using your clinical skills, by your microbiological diagnosis early, and then keeping them home quarantine depending upon the mild, moderate, and severe in the the symptoms. So as far we are going through the lockdown phase, so far number of cases in our country is little bit less, but you never know, because even a single case can be proved detrimental if can be if later on diagnosed on the very lately. So what we are doing it, we are doing it on an early basis, going through RT-PCR testing of the our patients who are coming with influenza-like illness. I mean the fever, cough, and a sore throat. Whatever reason could be of influenza-like illness, we are going through the COVID-19 testing, and if the patient is proven to be COVID-19, we are isolating that patient. Over to you,
So, sir,
Ankit.
what kind of patients and what kind of symptoms you are facing during the COVID thing? Because we have experienced that there are a lot of different symptoms in different countries, and that's why a lot of doctors are involved. So yesterday we had a doctor from Hollywood, and he's treating COVID patients, taking as all the asthma patients. Basically, that's how they treat to the asthmatic patients. So, what do you think about the symptoms and what should be the first way of treatment? Because there are a lot of experiments also going around.
So as we all know that there are certain groups of the patients like chronic, I mean the kidney disease, the certain lung disorders, certain heart disease patient like hypertensive, diabetes. They are the groups which we know that they are having the poor outcomes. But if we talk about the young and healthy patients, they are the one who present with the fever, cough, sore throat, and one of the very interesting symptom like the anosmia, the loss of smell. Also few patients are coming with the loss of taste also. These are the patients are the young healthy patients. And if you talk about the immunocompromised group patient, those are the ones who are getting into moderate to severe ARDS patient, I mean the severe bad lung disease or pneumonia, and also certain kind of arrhythmia in the form of ECG changes.
Okay. So when you talk about different patients with different symptoms, so that means they are coming from a different chronic or different illness or different maybe a different culture. Or, I mean, how you differentiate between them? Because the treatment of Lyme is also different as while treating the patients. Or I mean, because we have a lot of unanswered questions with our viewers and from us as well. That how should we take it forward?
So as far as the the our Indian guidelines are saying that we need to our suspicion should be very high, especially we all are going through this pandemic. So any patient I already mentioned that who has the history of the coming in contact with the positive patient, I mean who are laboratory confirmed patient, and anyone who's coming in contact with the laboratory confirmed case, or any healthcare worker, maybe he's asymptomatic or he's a symptomatic one. So those are the ones need to go to the testing, and based on those testing, we have to start our treatment part.
And we also heard a lot of news. Lately from China as well that they have reported new cases, and also some cases being infected on their brain as well. I mean, might be a brain hemorrhage or something which disturbs their mental level of thinking as well. Is it something parallelly going on in India?
Yes, there are, recently, even the New England Journal of Medicine has already published that the COVID-19 has impact on the neurological system. It could be central nervous system, it could be peripheral nervous system. Peripheral nervous system, which is one of the commonly affected in the form of, I already mentioned, anosmia, the loss of the smell, as well as the loss of taste. They are the peripheral manifestation of the neurological disorders. If we talk about the central disorders, then there are, the Guillain-Barré syndrome, the GB syndrome. The patient presented with a bilateral lower limb weakness, both leg weakness, and they are typical AIDP or Guillain-Barré syndrome patients, which we see in our neurological practice. So we need to be highly suspicious in terms of a patient of GB syndrome coming in our emergency department. First differential diagnosis should be on our mind of COVID-19, especially if we are going to the pandemic 19.
Okay. And sir, are we on the right track in terms of the treating the patients in India, or do you think we need to do a lot more strictness? Because we have seen during, I mean, still the lockdown is extended till 3rd of May, but we are still getting a lot of new patients and new reported patients coming up in Delhi, in Maharashtra, and other parts of the India as well. So, what should be
Yeah.
the take away from what happened till now, and what are the plans for next a month or maybe 3 months?
Yes, if already on the lockdown 2.0, already is going on, and today is the fifth day of the lockdown,
Yeah.
second lockdown. So
Yeah.
still we are getting the new hotspot areas. I mean, the hotspot area by mean in our country, a lot of new cases. I mean, those
Yeah.
who have been coming in contact with the patient earlier, now they are getting the symptoms. So those are the ones who needs to be, strictly quarantined to their homes. And even if they require any kind of help, our government is providing help to their doors. Chap.
And sir, when you go to the hospital on regular basis and treating those patients, what kind of precautions you are, following yourself and for your family, because you have to come back to home and you have a family to take care of, and every day is like going to a war, and then come back as strong as you can, and mentally also, physically and psychologically. So because we are very concerned about the doctors, because they are the front runners for us at this point of time. I saw you yesterday, and I was not able to identify you today,
Yeah,
basically.
yeah.
So I mean, how
Yeah, that's a very,
how you
yeah.
are preparing yourself?
That's a very important and very valid question at this point of time, because even if one doctor get infected, he can infect to the other patients. If he's going to the OPD, if he's going to the ICU wards, I mean, if he's going to the routine practice, he can infect his or her patients. So what he needs to practice is he has to be wear proper donning of all the personal protective gears in the form of a goggles, in the form of a N95 mask. I'm talking about the healthcare provider like me. So
Yeah.
the goggles, mask, and if you are going in a aerosol generating area, like patient we are undergoing the mechanical intubations, or patient on ventilators, so you need to be have the gown full gown, and that should be the rec- recon- affiliated through certain agencies which we have been designated, so that they should be not harming your body, and proper donning. And after that, while seeing the patient, and you when you come once you come out, you need to be proper doffing, because doffing are the step which has to be done very meticulously. You cannot touch your bare hands onto the outer surface of the gown, outer surface of the mask. You have to be extra cautious while doffing. Donning means putting on the personal protective gears, and doffing means
Taking it out.
removing the taking out of their personal protective equipments. So those are the steps which needs to be taken care while working in the hospital. While coming out to the hospital, you have to take care of your hands clearly, and then in the car, you need to again hand rub with the alcohol based hand sanitizer. And once you enter into your home, try to take out your shoes outside of your door, then come take a bath. Then you need to meet your children, or you meet your wife, and all those things after taking a good bath with the soap and water. Those are the things which you have to practice. And all of your clothes has to be gone to the hot water with a liquid soap, so that it can be also disinfected. So these are the practicing which we are doing it on a daily basis these days, to prevent our and our family also.
It's
Sir, we are concerned about this thing. We are concerned about your mobile phones, and we're concerned about the, how you manage your car as well, because those are also might be contagious while during the COVID situation. So, how you handle your goggles, how you handle your beard, and how you handle your earphones and mobiles. Does that also, a way to spread the virus?
So for that, I'll say there are 5 P's for mandatory for everyone. One is the personal protective equipment that we need to have. Second is, if the patient is having the fever or cough, he should also be wearing the at least a surgical mask or triple layered mask, as we say. Second, coming on to the P for phone or iPad. So as far as possible, try to avoid taking to the hospital. Try to keep your phone within the car only. And even if you're taking it, and the moment you come out, try to clean your phone with the alcohol based, with the cotton swab, with the alcohol based rubbing should be there. Third P stand for the personal belongings. Try not to take as much as personal belongings to the hospital, like carrying the female doctors carrying their bag and any kind of stuff, any books. So avoided should be avoided in this pandemic time. Fourth is posting of the science outside of your clinic, outside of your wards. There should be proper science should be there. So what are the science needs to be followed by your healthcare providers, and what are the science should be followed by the visitors. I mean, those visitors who are coming to with their patients. What are the science they have to follow? Last and fifth P is the pre-screening visitors. All the visitors, whether they are the patient in the patient form or they are the attendants, they has to be pre-screened in the form of infrared to detect any temperature. And second is, if they have any fever cough, they should first be sent to the the flu clinic. So these are the 5 P's which I practice in my daily day-to-day basis.
But sir, while following these 5 P's, I mean, are you? Can we say that we are 100% secured, or we are 100% able to cover or shield ourselves from these viruses?
So there is no such 100%, because to err is human. So anybody can can commit mistake in any of these steps. But by practicing all these 5 P's, we can minimize the contagious virus of transmission. We have to break this chain. That is our
Yeah.
main motive is there, because you never know that a person who I am coming in contact, he later on turns out to be positive, or he can develop symptoms after 2 days. So for every patient, we have to assume that he may or may not be a potential uh, carrier of the virus, and we have to follow all the 5 P's in our daily practice. So P for practice and all the
And
5 P's. Yeah,
yeah. And
no
also, I
problem.
mean, when someone is COVID positive, so what are the steps? What medical fraternity and government? Government is also helping you how to take it. But what are the precautions and steps a doctor carry once they know that someone is COVID positive and he is at his home right now? So how can we discuss the step by step monitoring and how you bring
Yes.
that patient to the hospital, and what are the ways to treat them?
One thing is that suppose if one of if talk about me only, so if I develop these symptoms, I'm not a healthcare provider. So first and foremost step is the I should inform the helpline number, and there has to be proper history given to the the any healthcare provider coming to our doorstep. We should not hide any information from our government, because government is already doing a lot of hard work to break the chain of this virus. So once the healthcare provider coming to us, they will take a history, they will filling our forms, they will be taking the our nasopharyngeal swab for going for the testing in the our any particular lab. And once they done with this kind of testing, being that in the meanwhile we have to be quarantined at our home, try to avoid coming in contact with any kind of non-immune person, sorry, any susceptible person. Those who have not developed the symptoms, they should be quarantined and should be separated, and I should be quarantined in any different separated room. Second thing is that even if I turned out to be positive, so the
Yeah.
persons who have coming in contact for the last 5 days or 10 days, they should also be screened in a similar way that when as I have been screened by the government of India. So the moment I turned out to be positive, so I need to watch my symptoms. If it's mild, I can be managed at home very safely. Uh, bec- and the moment I develop the symptoms like any change in the shortness of breath, any kind of hemoptysis, any kind of abdominal trouble, any kind of again the CNS symptom, neurological symptoms. So I need to take the help of again the helpline number. I need to go to the designated hospital. If the government vehicle is not available, if government vehicle is available, then it's a good thing. You can be taken from your home and directly to the government hospital where you can be treated. Or even if the patient wants to come to the any private or corporate sector also, there has to be in a proper way. He has to be in a designated vehicle. He cannot come in by his own at on by road, by coming in own vehicle with the all the family members accompanying him, because it can spread to other persons also. So there are things which need to be taken care while managing a suspected patient of COVID.
So a lot of, lot of guidelines are for patients and for how to do the testing and how to monitor it and all those things. And you said that we have to guide the patient to follow the right step. what are the precautions for the family members of those patients? What kind of precautions they have to take? Because symptoms, you know that symptoms can start from day 1 to day 14, or maybe extended as well. So, what are the symptoms the family members should follow? Because you know that how we live in India. I mean, we have joint families and we have so many people living under one roof. And if something happened to someone, how contagious is that? Because if you follow the news, what happened in civil lines today in Delhi, I think
Yeah.
I'm not sure about the number. All the family members are, COVID positive. That's what the news is. I'm not aware about the treatment, but that is what the news is. So anything for the people who are near to the hospitals who think that there is some symptoms, so they have to take some physical distance, and how they should do it, because that is what our viewers would like to know.
You are absolutely right, Ankit. Definitely, this is a very big problem and big challenge to our country, especially the one to those families who are living in a single roof. And number of people are sharing a single room also in India. A lot of people are sharing. So, if any of these symptoms develops in any of the patient, he can be contagious to other persons. So, what they can do is they need to be, practice this social distancing in terms of that going outside for the routine, or without any need they are going out, so that should be avoided. So because even if they take the virus from outside, then the one person can infect the whole person staying in a single room. That that cannot be changed. Persons who are staying in a single room, that cannot be changed. So better is to avoid going outside. Even if they're going outside during the lockdown period, they should be going with the face mask properly, whether it's a homemade mask or it's a surgical mask they are using it. Second thing is, if they are ordering something from outside or they're drinking something from outside, try to clean those surface disinfection. I mean, touching the knobs, or touching the door handles, they should be cleaned with soap and water or with the alcohol based hand rub. So those are the things which need to be practiced. Even at home also, try not to be in a very close contact, sitting in a very close face to face. They has to maintain a distance of at least 2 to 3 feet minimum. Better is to maintain a 6 meter distance, or 2 feet. But it is advisable to maintain as much as possible, because you never know that anyone can cough, and he or she can transmit the virus to the partner or something, your kids. So they has to practice in the closed room. It's a big challenge for our country.
But you know that, whatever you have mentioned, that could be a ideal way for people living in metropolitan cities in India. What about people living in rural cities, villages, and small towns? Because their way of lifestyle and culture is way different from what how we are living in Delhi, or maybe in Bombay, or other parts of the metro cities.
So in that context, I'll say that I think the COVID has taught us, not only the urban population, the COVID-19 has given the lot of information about the hand hygiene practice, about the facial hygiene practice to the the rural people living in the rural of our country. So rural people, they also know that we need to wash our hands with soap and water. If
Yeah.
required, we need to cover our face with the mask if we are going out, especially. And because most of our rural people are engaged in the agriculture activities, so they may come
Yeah.
across with any positive person. So better is when they're going in the fields, they should be wearing the homemade mask if available to them. And second thing is that they need to be wash their hands, because they might be coming in any contagious surface. You never know that which surface is the contagious. So they need to practice the frequent hand hygiene, and they should be also be given the teaching in the form of the radio broadcasting is there these days. So they are in a usual habit of listening to those radio broadcasts. So what they do is
Yeah.
they listen to those things, and they also practicing even in their as small as rural villages there. So even their children also know this thing, that the coronavirus is in our country. To break the chain, we have to follow certain steps.
Okay, and I was going through your profile, and it says that the areas of interest are transplantation infections and tropical infections and travel health.
Yeah.
So, can you elaborate
Correct.
what are these terms for our viewers? Because we would like to know more about your interest and how, our viewers and patients can, reach out to you if there is some issues or symptoms they're facing.
So as I already mentioned in the initial part of my talk, that the patients who are, those who are having the poor outcomes, they are the ones who are having the underlying, organ dysfunctions in the form of chronic lung disease, liver disease, kidney disease, and over that if the patient is already undergone transplantation, the body is already immunocompromised with a lot of drugs which has
Yeah.
been given to the suppression of the organ. So those are the ones, even the symptoms developing in these kind of patients, you cannot, there cannot typical symptoms. They can be
Yeah.
presenting in a variety of symptoms can be there. So those are the ones who need to practice the, social distancing, hand hygiene, and all those things. Apart from that, my duty is to detect if the patient is coming to my clinic in my chamber. I should, have a proper sign over outside my clinic that yes, you need to wear the mask. You need to hand rub your, properly if you touch the any kind of surface. And the
Yeah.
third thing is, even if you have symptoms, before coming to the hospital, before coming to my clinic, call my, my member, and he will be informing me. Yeah, he will be informing me that is these are my patient who are having the respiratory infection kind of symptoms. So I
Yeah.
will be, my whole team will be more cautious in dealing with these kind of patients. Second, my expertise is in the tropical infections. So, as we all know that our country is a tropical country, we used to see a lot of tropical infections in the form of malaria, dengue, chikungunya, and
Yeah.
scrub typhus these days. A lot of scrub patients are coming these days. So, they all can present along with side by side with the this COVID-19. As we know that, these days we are having the mm, rainy seasons
Yeah.
about to come in the June July part of monsoon. So cases will again going to rise. Patient coming with febrile illness, we have to be very cautious. He could be malaria, he could be dengue, or he could be COVID-19. So we
Okay.
cannot miss that. Every patient, we cannot think that it is a COVID-19 only. If we keep
Yeah.
on looking at the COVID-19, we will miss the malaria part. That is easily treatable by the chloroquine.
Yeah.
So we have to be extra cautious. Third expertise, which I did it, I am an International Society of Travel Medicine member also. I am a travel health expert from US only. So my field in this is that to patients who are coming from the abroad to our country just for, visiting travels and routine, visiting our family members, those are the patients who need to be screened, on various, strategical models. Like if the patient is having fever without any acute respiratory symptoms, they should be quarantined. If the patient is having fever and along with the acute respiratory symptoms, those are the ones who need to be go for the COVID-19 testings. So those things which needs to be considered maybe in the next few months, because till now, because of lockdown, no flights are working. But
Yeah.
over the next 1 or 2 months, as soon as the, the lockdowns opens up, so we have to be extra cautious with, movement of our commuters. So we have to be
Yeah.
extra cautious. Yeah, yeah,
Yeah.
Are you
And Dr. Jatin,
finding?
as you mentioned, yeah.
yeah, yeah, yeah,
Yes, Kimberly.
yeah,
I
yeah.
was just curious, are you finding any one particular drug or treatment to be more effective than the other at this time? And could any of this be done to be treated at home so that the people do not have to leave their home and can be treated at home, almost like we do? I hate saying this, but like we do with hospice, sometimes we bring the treatment home. Unfortunately, hospice is more for people who are going to die, but is there something that you're finding that's been more better received?
So as far as the our Indian recommendation or Indian guidelines are concerned, so patients who are, whether they are asymptomatic or they are symptomatic, but they should be on mild infection. So those are the ones our country is recommending the hydroxychloroquine these days. So hydroxychloroquine is a drug which is being recommended by our country to be taken either by the healthcare workers or by the household contacts. So they can be taken as a prophylactically also. They can be taken as prophylactically 400 milligram on day one, twice daily, and then on once on a weekly basis. But if you are getting the symptoms, suppose I am the patient, I am getting the symptoms, and my symptoms are mild, I don't need to go to the hospital, and I am coming out to be positive. So I can be started on the hydroxychloroquine, but after the advice of my concerned physician. I cannot start my own because you might be knowing that the hydroxychloroquine is a drug which is now being, not being used but abused these days because of the hype. A lot of articles have loaded about the hydroxychloroquines. So people start consuming of its own. So that can be, dangerous, lethal. So after the doctor's advice and after the EKG, that what is called ECG, to look for the any abnormality in the ECG. If it's not, then that can be safely given. So this is a drug which is our country is giving so far. Apart from that, patients are advised to rejuvenate his immunity in the form of you know uh, antioxidants. There is no harm, although there is no data from the COVID-19, but yes, we have the data from the influenza and other infections in the past like pneumonias. So they can be of little bit help, like vitamin C and other vitamins like vitamin B1. They should be complemented with the hydroxychloroquine. There is no harm, but precautions to be taken is avoid using the drugs which can prolong the QT interval in the EKG, which can be, prove lethal if you are already taking on hydroxychloroquines. So our history should be very important when we are dealing, with the COVID-19 and patients is having the underlying heart disease or patients who are already taking those drugs who can prolong the QT intervals.
That's interesting.
So, yeah, sorry, please.
I'm curious, have you tried any of the standard respiratory treatments when people get asthma? Have you tried any of those, like the prednisones, the inhalers, antihistamines? Has that been tried yet?
So what we are doing in patients who are already asthmatic, we are keeping him and patient who are already taking those kind of inhalers like metered-dose inhalers, MDIs, or any rota caps, rota inhalers. We are telling them that keep continuing those inhalers. Then no need to stop them. Yes, if they are taking any kind of steroids, yes, we are in a judgment that whether they need to be stopped or they need to be supplemented with any kind of antibiotics to prevent the superimposed bacterial infections with the COVID-19.
Okay. Now, I was wondering because we've heard some researchers talk that they have seen a significant difference in those who are receiving the respiratory medications, that they're doing quite well when it comes with the COVID-19, because COVID-19 does cause inflammation, right? It tears. The corona tears at the sinuses, and tearing causes inflammation. So they said that they've been finding significant progress in patients who have had already been taking the asthma and upper respiratory treatment. So I was just wondering if that's something that the world has been seeing as well, or are we just kind of strictly staying with the hydrochloroquine?
No, as far as hydroxychloroquine is concerned, I already mentioned that those are the patients who are coming out to be positive, and they may or may not be having the underlying, any comorbidity.
Okay.
But if you talk about any asthmatic patient, any particular patient, yes, they are already having the poor lung compliance, or those are the patients who are having the COPD, or I mean the chronic obstructive lung disease. They are already having the lung compromises there, so they are the patient who need to be monitored for their vital capacity of the lungs. They can land up in the ARDS or severe pneumonia.
Okay.
So those are the ones which needs to be put on the oxygen therapy, whether in the form of a nasal prongs to avoid aerosolization, prevent aerosolization by the nasal mask. Nasal mask to be avoided. We can put on the nasal prongs. If required, a patient can put on the the BiPAP therapy, but and that too again with a precautionary measure, because BiPAP therapy also generates the aerosols. So because asthmatic patient, we have data from the New York also. I think the patients who are asthmatic, they are the one who are developing the severe symptoms of in the form of ARDS or severe pneumonia. So in that patient, we need to be extra cautious. That's the only thing which I say.
So, is it your belief that the warmer weather and more humid weather is going to slow down the growth of COVID-19, or do you think this is a myth?
Yeah, that's a really very valid question. Might be the rise in the temperature could have some effect on the decline in the COVID-19. But if you look at the host which is carrying the COVID-19, we are the patients are the host, and in the human beings the temperature is already 37 degrees Celsius. So it's not going to change. It's not going to change.
I
It's not
didn't
going
think
to
so.
change.
Thank you
Also,
for
we have
saying that. Oh my gosh, I have been saying if it's the hot weather that's going to slow it down, then why is my body the host? Because my body's way up here. Thank you. Yay. So no, I mean, this is probably not good news, but we're learning so much about this, so we're not afraid of it, right? I think when you're afraid of something and you're panicked and you're reacting, you you tend to see a bigger panic and it gets worse. I think we're getting a little bit closer to not panicking anymore and slowing down the growth curve. Are you feeling like that there's a flat line in the hospitals? Like
can you please Kimberly,
growth.
come again? I will.
Maybe you can ask.
Yeah, Kimberly, can you please come again? The voice was cutting out.
So, do you see a decline now from the beginning to now? Do you see a decline in the in the
Okay, the
amount?
number of cases.
Yes.
Okay,
Yeah.
so if you talk about our country, definitely, we are, the cases number of cases are creeping slowly and slowly. And the since we are in the lockdown phase, so trajectory is, under stable condition so far. The number of cases are under control, and since with the lockdown, we not entering into the community phase of transmission. Still, we are in the the phase two or phase three of the transmission rate. We have the lot of patients who are coming positive, those who have a positive contact history. We're not seeing a patient who is random, coming comes out to be positive without any history of coming into contact. So phase three of WHO, which has been already been mentioned earlier, and World Health Organization divided into four phases. So third phase is still to become, in Indian picture, if we don't follow the guidelines as being recommended by us, the social distancing and the hand hygiene practices, you know, cuff etiquettes, and apart from that, the wearing of this facial mask. So if we keep doing those practices, still we can avoid going our country into the phase three of transmission. So far, we have it's such a big country with a 1.3 billion population. We have around 60,000 cases so far. So still condition is under control, and I hope that this should be in under control only. I don't want to be see the numbers in lakhs or in crores so far.
Okay. You've brought up some really good points that PPE is very, very important. Hygiene again is very, very important. But I think the thing that's helping your industry the most is by us staying home. Am I right?
Yeah, I'll tell you why. Because this virus is a very egoistic virus. We keep on saying in our, our family also, it's a very egoistic virus. So unless and until you don't bring this virus to your home, or this virus doesn't come by its own. So this is a very egoistic virus. You have to respect his ego. Ask him, "Yeah, you should remain outside only. Don't try to come and our home." So if we
So,
follow these
Dr.
simple
Jatin,
precautions,
you mean to say that
pardon, I think your
the
voice
virus is like a politician?
a virus is like a
Virus is like a politician.
Virus is like a
yeah,
politician.
yeah.
I mean, more about the ego. Egos going around.
It is a very egoistic virus. These things comes in a century. We have observed this thing. Yeah, hello, Philip. So we have observed such a pandemic, large pandemic, after a very long time, and that too with a
Yeah.
very egoistic virus. So if just by following simple steps, if we can satisfy his ego, it's better to follow the steps. There's no harm in following those steps. No, that is the free of cost treatment.
I
Yeah.
love it. Thank you
So
so
we
much.
have
Great.
we also had invention of this coronavirus against the coronavirus, and I'll just quickly show you the treatment. This is what we are offering.
Yep. That's the only pill. You know, the only way to prevent is to stay home. It doesn't 100% prevent. We've learned this. A few people have claimed to have received the COVID-19 by getting packages, because I think we still don't know how far it carries, how long it lasts. I've been doing research of when the first COVID was discovered, was a long time ago. Um, and we don't know. We don't know the nature of the beast and how far it will go. We just know that each strain gets stronger and more powerful against the human. So I think staying at home is not a bad thing. I think it's allowed a lot of us to get closer to the families, right, Ankit?
Yeah.
That's what we
Get
are.
closer. We've gotten closer over this.
Yeah. Thank you very much.
And
Thank you
Willie,
very much.
thank you.
So, Dr.
Doc,
Jatin, I have a question from our viewers that how soon we see normal, life in India?
Can you please come again, Ankit?
How soon we can
Hello.
see normalcy in India? Are we
Oh,
still far from the normal life?
that's a very tough question which you have given to me. Well, the government is already on the track that from tomorrow, that is 20th of April, there are
Yeah,
certain opening of these, like essential things which need to be, on the track as soon as
yeah,
possible. And there are certain
yeah,
small scale industries which needs to be reopened to maintain our economy also. And
yeah,
but with the, with the precautions that those are the workers working under those small scale industries need to follow the all the strict guidelines by the government of India. And similarly, with the schools, gyms, and malls, they need to be totally shut down. They don't need to be open, I think, down the line in the next 2 or 3 months. But those things which have a contribution towards our economy, they needs to be open. We cannot keep moving our country with the lockdown for a next 3 or 4 months. So that has to be open up, but with a precautionary measure.
and you're talking about internally to the one country, but we are a world that operates globally. And I know that what part of your practices is about travel medicine as well. Can you define to me, what do you think would be good stage processing to get back to international travel or just long distance travel in general? What are some good? What do you think our stages need to be? We don't need to do it now, but say 6 months to a year from now, how should we stage back to travel?
So yeah, I think the 2 days back I have heard a news about that Emirates is planning to start the services of the serological testing. So these are the under trial things these days. So
Right.
after down the line in the next 6 months, there has to be certain policies from all the countries. Those are the hotspot areas. They need to be restricted travels, and those are the where the pandemic has been under control, and the travel is a prerequisite. Then in those cases, with the use of the again the all those measures like facial mask and maintaining the social distance, even in the sitting of the inside the cabin also, you need to be take extra precautions, and carrying all the time with the alcohol based hand rub in your pocket, or they had to be provided by the the international airlines, because you never know, you can coming in contact with the surface and that maybe may or may not be contagious. But it's a long way to come. I mean, it's quite early to comment upon that, but I think those are the precaution measures which need to be followed. I think not over the next 6 months, but in the next few years also, because this virus will gonna stay in our community. Like influenza, this virus will not going to, we cannot say that after the 3rd May our country lockdown will be end and virus is going back to the China. It's not going to happen. The virus is going to stay in our community, and we have to follow the all the precautionary measures over the next few years. We have to change our habits, although it's very difficult to change our habits which has been inculcating it for the last many years. But
Yeah.
we have to change our habits.
Well,
Similarly with the, yeah, sorry, please.
no, go ahead. I agree with you with changing our habits, and I think part of it needs to reestablishing our immune system. I think that needs to be one of the most important habits that
I think
we.
your voice has been dropped.
We are talking about the immunity system. So, do you think
Kimberly,
the immunity
yeah,
system play an important role while, I mean, maintaining your day-to-day lifestyle and also be kind of a shield for yourself to protect yourself from viruses? How good is your immunity level should be? I mean, to protect yourself from these kind of viruses.
Ankit,
Because
your
what we were
voice is
discussing,
Can't hear. I don't think he can
is,
hear you.
yeah, sorry, voice is
can you
dropping.
hear it
Yeah,
now?
now it's clear.
Yeah.
Yeah, now it's
So
clear.
what
Yeah, please.
even I would like to ask you is that how important is the immunity factor in this current situation? And also there are a lot of viruses, I mean, roaming around. I mean, maybe we have some more viruses like Corona in future as well. So how important your immunity level will play in terms of creating a shield for you to protect yourself from the virus?
So this is 'cause these are the questions which I get across on daily basis. That
Yeah.
how I'll gonna prevent from coming in across this virus, or how long this the pandemic will going to last. So my answer to this question is, sooner or later you have to come across this virus, either in the
Yeah.
form of a active infection or in the form of a vaccine. So since now we don't have vaccine, so what
Yeah.
we want to do is we have to follow the our precaution. Even if we come across with the virus or we get the symptoms, we have to be extra cautious about not to infect others. One thing. Second thing is, try to maintain the healthy lifestyle. We are in the lockdown state, doesn't mean that we don't maintain our healthy lifestyle. Try to
Yeah.
maintain the healthy lifestyle that have the totally impact on our body. Have a positive mindset, have a healthy lifestyle, and maintain a healthy diet also, because
Yeah.
immunity is the only thing overall that will gonna protect you from this virus. So I have only two things to say: immunity,
Yeah.
and the rest is the rest left on the God. So these are the two things, I and G. Immunity, that is yours,
Okay.
and G is the God. Only those
Yeah.
two things are gonna play a major role. So third is the, if you
Like in
get sick
hospital.
and develop the severe ARDS, then only you land up in the hospital. And you already know that patients who are severe pneumonia and with the underlying comorbidity, they are having very poor outcome. So only two things: boost your immunity as much as drinking good hydration, good fruits, vegetables, and the last thing is have a faith in God and your immunity. Nothing else beyond that.
Those are
And wait for
great.
the vaccine.
Those are
One,
blessings.
one
That's great.
question, yeah, one question,
Rocky.
Doctor.
Shakir.
I just came across a news item which said that the virus is now in three forms. That is COVID-19A in China, COVID-19B in the Near East, and COVID-19C in Europe and North America. So I was just wondering where India sort of came into all this, because
I think, sir,
yeah, I'm just wondering if we know what strain is there in India amongst this A, B, and C. Just wondering. You may or may not have this information.
yes, I really don't have idea about this, the strains. But yes, India is one of the few countries who have the uh, proper genome sequencing of this virus. But
Okay.
if you talk about the between the virus, between the Wuhan virus, or if the virus in the New York or virus in our country, more likely it's one or same thing. Yes, since these are the RNA viruses, they have the tendency to mutate. They have the tendency to mutate, just like our influenza virus. They keep on changing their nature. But so far, I don't think so. I have any data or I have any idea about that this virus is something different from the other countries.
And
Thank
also,
you.
Dr. Jatin, one of the doctors on our show discussed that we can treat COVID patients while providing the same treatment as the asthmatic patients. What do you say about that?
You're asking to me, Ankit?
Yeah.
Yeah. So your question is how asthmatic patient can be treated if the
So
patient
basically,
comes up.
so we have some medications and some treatment lines for asthmatic patients. So a
Okay.
lot of doctors, or maybe one of the doctors we know, I mean, he was on a show yesterday, and he
Okay.
was saying that he is following the same treatment for the COVID patients as well because of the same respiratory issues. What do you have to say on that?
So look at the asthma. First of all, we have to, any disease which we're gonna treat, we have to go under the pathophysiology. Asthmatic is a condition in which the small airways, small to medium airways of our lung get constricted.
Yeah.
If you talk about the COVID-19, there is a pathophysiology totally different. It is the
Okay.
interstitial pathology. It is the interstitial pathology. If you look at the CT scan, there is a ground glass haziness. There is a reduction in the lung compliance. So if you go for the spirometry test, if the patient is having the pure, asthmatic, there is the obstructive airway disease. If you talk about the COVID-19, it's a kind of a restrictive lung disease. So restrictive lung disease means there is a decrease in the diffusion capacity of the diffusion of the oxygen. uh, Exchange of the gases will be hampered. That is why patient of the COVID-19 going into hypoxic respiratory failure. So both the pathophysiology is totally different. One thing. Second thing is, suppose a patient of asthma superimposed with the COVID-19. So they will be having double insult. One
Okay.
with the obstructive airway disease, second with the restrictive airway disease. So those are the one going already with the reduction in the lung compliance, lung compromise already there. Patients going in a severe respiratory failure.
Okay. So I would welcome to our new guest. We have Dr. Philip Yu joining us from LA, and then Dr. Sabgu is joining us from New Delhi. We have Dr. Jatin.
Hello. Sat Shri Akal ji.
Hi, Sashkal, Dr. Jatin, how are you?
I'm fine, Dr. Sagu.
Yeah.
So we've had a
Hi.
lovely conversation about
Right.
general practices with COVID patients in India. I think they have such a great non-planning process and approach now to COVID disease. We also have Nicholas Palaveda on now, the senior executive producer of IBM TV. Welcome, Nicholas.
Hi, can you hear me?
Yes. Welcome, Dr. Sagu.
Yeah. Hi.
Always good to see
Thank you
Dr.
so much.
Sagu.
You welcome to you.
Welcome.
And I never got to say good morning to my Rakesh. Rakesh has been on the show with us every day from home. He has definitely been a blessing, helping us get through this with some brilliant questions and information. But I am so interested in the progress that India has made, because it's been more, like you had mentioned earlier, too, on a spiritual basis. I always say that a lot of success in recovery is up here, right? And what we feel here and here. That's success in anything. I preach on this. That is success in anything is your willpower, right? What's up here and what's in here. And I'm grateful for you sharing these things, because when we have that, we can approach without fear. And you have factually proven success, that India has lowered the death rates. This is something we've heard from Australia too, which has been very encouraging to me. Do you know Australia has only had 70 deaths during this whole pandemic? Just 70. That's just absolutely amazing to me.
Yeah, that is pretty good. But my question is, and this is a question that's coming up here in the States, is what about going back to work? There's a lot of people that are complaining, especially when large companies like Costco and Walmart are open. Target was open. I was there yesterday. Yet a small vacuum cleaner store has to close down that usually has 1 or 2 people in the store at any given point in time. So
I just want to say something about that vacuum store. I don't think I'd mind being in it. If it's a good one, it's going to vacuum up all of the air with COVID, and all the COVID's going to be in the back.
Dr. Yu and Dr. Sagu, why can't we open up some of our businesses?
Well, here in, can you hear me?
Yes, we can hear you quite well.
Well, here in California, with the governor's, wisdom, it's like only essential businesses can stay open.
So what constitutes essential?
Exactly. I mean, so we're in a gray area because, I have 2 practices. One is the chiropractic wellness center. So you could argue it is essential because we're taking the stress off the ICUs and urgent care. You know what the number one reason someone goes to a doctor in the US? Back pain.
Mm-hmm.
So if you're not letting the chiropractors, the orthopedic surgeons, the physical therapists, acupuncturists, or any type of, non-surgical practitioner to open, where is people going to go? The hospital. And they're going to overburden the hospital staff, which should be concentrating on the COVID patients, right? So it's ridiculous. And then dental clinics are struggling because no one's going in. Mm-hmm. But liquor stores are open. So go figure.
Right.
Alcohol destroys your body's endogenous stem cells. Mm-hmm. And it's your body's stem cells which immunomodulate your immune system to fight these viruses. Mm-hmm. All right. So it's like I said, the problem is the people who are running the hospitals and government making decisions on healthcare policy mm-hmm. are not healthcare professionals themselves. Right. So how can they possibly make these decisions when they are not on the front lines, like the nurses risking their lives, mm-hmm. treating patients without any proper PPEs? Kim, did you see that IOC? I never watched TV, but I happened to be walking past. My wife was watching the news here in LA, and there's St. Joe's Hospital. It's one of the big, community hospitals, and St. Joe's administration is not providing the nurses with masks and shields. They're unprotected. They're like, oh, you got to get out on your own.
But if you just listen to Dr. Shane here earlier, that he spoke about that being one of the most important parts of the medical practices routine is the PPE. And I had received a contact from a close friend for many years, and she was almost in tears. And she said that they're firing the doctors and nurses. And like you had mentioned, they're putting them on furlough as well because they're not giving them the medical protection they need. They're not giving them the tools and the resources.
Yeah, and then when you complain, what does the hospital admin do? You're furloughed, you're fired, you're reprimanded for speaking up, because they want to maintain a good image, yeah. So, like there was that emergency room doctor in New York. His video went viral. He was saying, this disease doesn't make sense. It doesn't follow the classic pneumonia patterns. It's like out of control. We don't need intubators because only 20% of the patients at intubation survive. It actually causes more stress on the lungs because these elderly patients that are already immunocompromised, they already have some type of lung disease like pneumonia, and they don't have the lung strength to breathe in the oxygen from the intubation. So they gag, they get more inflammation, more stress, they get acute respiratory distress syndrome. and the mucus makes it more hard to breathe. So it's like it's choking them. What they need is oxygen. And I'm glad Dr. Segua is here. Maybe he could chime in on how hyperbaric oxygen, more oxygen delivery systems is the solution. There's a small company in Texas. They're a hyperbaric oxygen company, and they made a portable one. It's a clear helmet, and you got the oxygen tubes, and that will deliver the oxygen. That's a solution, but you never hear about this. What does the CDC still say? Oh, we need more intubation. Oh, now you need an N95 mask.
Right.
After the fact. They just came out with that 2 weeks ago. Oh, these masks by Triple M only are going to the ICUs and hospitals. Well, where are these masks? Problem is, there's only 3 Triple M mask factories in the U.S. Most of them are overseas, so we can't even get them in the country.
That's not good. I actually have an N95 mask. I mean, you know, you'd figure everybody would have. I had one prior to this happening.
$100 now if you want one.
Really?
Yeah.
Oh, I'm willing to sell mine for
Yeah.
but I have one, and I read the same statistics you do, Dr. Yu, that when you intubate through these ventilators and they're acting like this is a solution, the mortality rate's 80%. So you basically lost the game the minute you have to go that direction. And then this new drug remdesivir that they're touting still has an 18% mortality. Now, the good news is most of them survive, but you know, we're not
the answer, because
we're not sure if they would have survived anyway when you have an 18% mortality.
There were like 2 or 3 studies in China with remdesivir, and I guess they got the patents on it conveniently.
Yeah,
I think in January or February before the supposed outbreak. It's like, I mean, why is the very country that this pandemic originated from, why were they investing in these studies in the antiviral remdesivir before the news broke out? It's like too convenient.
Yeah.
And we know the answer is not just drugging people. Like we were talking about earlier, it's your immune system.
Right.
Natural immunity is already in your body. And that's why I'm always saying you got to take all measures to stay healthy. The bottom line is to enhance your body's God-given and endogenous stem cells, which we're all born with. I was just listening to a podcast yesterday. Now, although I drink coffee, I'm drinking the Bulletproof coffee. We talked about it as grass-fed butter, omega-3s, highly concentrated coconut oil, which has lauric acid. Butyrate is very healthy for your gut. Lauric acid is an antiviral. It breaks down the cellular wall of the coronavirus and other, pathogens. But the podcast says if you drink more than 1,000 milligrams of caffeine a day, it could suppress your body's immune system. Now I'm going to limit my coffee to 1,000 milligrams, whatever that works out to. And a cup of blueberries a day enhances your body's stem cells. And that's why the mortality rate, if you're 80 or above, is more than 10% if you get the COVID, because at that age, only 1 out of every 2 million cells is stem cell. So you don't have enough stem cells to make your immune cells to fight the virus. A newborn baby, 1 out of 10,000 cells is stem cell. All right. So let me share my screen and I'll show you the stem cell chart. Let me show you here. Can you all see so far?
Yeah. Well,
right.
Your screen.
You got to share your screen. Press the button to share screen.
Let me see how I could do that. Entire screen. Maybe application window or Chrome tab. Let me see. I'm used to Zoom. Let's see.
Yeah.
So in share screen you have 3 options. So you can select either of the options and select your tab.
Okay. So I selected entire screen. Let me know when you can see it. Can you see it?
Not
Let
yet.
me just put it on. Yes.
Yeah, you have to pick me, right? Can
You
see
have
my-
to pick.
Yeah.
Yeah. Now we can see it. Yeah.
Okay, my desktop is a mess, right?
Yeah, you're busy.
Yeah, that's because I'm downloading so many different files from the latest research. But let me show.
Desktop has COVID.
Oh,
Oh my gosh.
Yeah,
It's like a world map for us.
Yeah.
if your desk is clean, you're not busy. That's my theory.
Yeah. So
now you guys see the stem cell?
yes.
Yeah. So what is a stem cell? So the type of stem cell we use is adult stem cell. So it's not embryonic. Embryonic stem cell is the type of stem cell you get before the baby's born, all right?
Yeah.
From the blastocyst stage before it develops in the fetus. And that's controversial because theoretically, you are killing a potential fetus, a human being. So we don't use that. And we cannot use that in the US because George Bush banned embryonic stem cell research anyway. So we use adult stem cell, which is taken from the umbilical cord after the baby's born. So you can argue that that's ethical because the baby's already delivered, healthy. We're just taking the umbilical cord that's normally thrown away because those umbilical cord cells are day 0 old, which means they're more potent, they're more vibrant to boost your immune system and regenerate tissue. All right. But of course, in the FDA's wisdom, they used to ban stem cell therapy in the US. So people would have to fly to Germany, Switzerland, Russia, Panama, or Asia to get it done. So finally, Obama signed the 21st Century Cures Act, and Trump signed the Right to Try bill, which, hey, if you have a disorder that has not been helped by traditional means, drugs, injections, surgery, you have the right to try stem cells in the US, right? It's not approved yet, but under the Right to Try compassionate use bill, you can try it because these people are not able to fly overseas, and now you can't fly there anyways. The first way to get stem cells is from your bone marrow, and this is FDA approved for leukemia, blood cancer. But it's very invasive. They drill your hip, and there's not a lot of stem cells in your bone marrow, so they could take a lot of blood. It's under anesthesia, very risky for an infection. And then they started taking stem cells from your fat. But the problem with that is you got to mix it with a chemical called collagenase to separate the stem cells from the fat cells. And that's not FDA compliant because you're mixing it with a drug. So FDA doesn't mind you do the stem cells as long as you leave it in its purest form. It's called non-manipulation, and you're not mixing it with the drug. So they don't like stromal-vascular fraction, which is adipose-derived stem cells. You don't want this type anyways because the stem cells in your fat are just as old as you. So does it really make sense to take out a 65-year-old stem cell from your fat and put it in a 65-year-old body or body part? It's really not going to work or last. So what's the solution? We got to get stem cells from a young source, a newborn umbilical cord source. The baby's already born and delivered. We're just taking the waste product because the placenta, the umbilical cord is normally thrown out, but now it's donated to a lab. It's cleaned and tested where we could take the cells. We can give it to the recipient, which will enhance their immune system, make natural killer cells, T lymphocyte cells to kill viruses like the COVID. Those are the studies that in China that have been shown where severe COVID patients, the symptoms have been reversed in 2 or 3 days after umbilical cord tissue was given to these patients. And now there's a lot of rapid approval umbilical cord and exosome therapy for COVID that has gotten rapid approval in the US. Now look at the chart. The chart is like the death chart in the COVID patients where if you're 80 and above, most likely those are the patients that are going to die from the COVID.
Right.
But really there's been no deaths if you're 0 to 17 years old. And the reason why is you can see as you get older, your stem cell count decreases. So the older you are, the more you need stem cells from a young donor. It just makes sense. Here are the different human cell tissue products. A lot of people, they can get PRP. That's when they take some of your blood, spin it, and they give it back to you because there's platelets and growth factors. But again, those growth factors in the PRP are only as good as their age. And if you look at the chart, if you're over 30, your platelets, growth factor, stem cells are already decreasing in count, decreasing in virility. And then we have look at the bone marrow. There's not a lot of stem cells in the bone marrow. And look at the adipose. There's a little more stem cells in there compared to bone marrow, but they're old. And you can see clearly that the umbilical cord tissue called Wharton's jelly, which is the surrounding membrane, has the highest count of stem cells and growth factors. And that was the tissue that they used in China to completely reverse the symptoms in 2 days of COVID. We could see a lot of athletes, this is their secret. They fly to Europe, they get stem cells. Here's what happened to Jack Nicklaus here. Watch this.
You have to unmute him.
You're going to have to exit out, and when you go back in, click to put sound so we can hear it. So
Okay.
Stop your share screen.
What I'll do, I'll just talk about what's going on there.
Sure.
All right.
Because we could play the sound. It you didn't click the button to do that.
Yeah, I don't see it, so
Well,
instead of
you
fumbling around, I'll just explain what's going on.
Okay. It's real simple though. If you stop share and then hit share again, and then when you hit share, there'll be a little button at the bottom that says video. And you click audio, and it will share your audio.
Yeah, but you brought up an interesting point, is that the thing is young people are not affected, at least mortality is next to zero until you hit 60, and that starts taking off to 67.
Yeah, and you saw the stem cell chart.
Right. And the
After
stem
30.
cell,
See, most athletes retire at what, 30? Why?
right.
Because they don't have stem cells to repair their hormones, their joints and muscles.
There's a breakdown.
Now, after 50, it takes a real dive. That's
Right.
why after 50, they say everything falls apart. Even
Yeah.
40, my joints hurt. You get
Right.
cancer, heart disease, diabetes, because your stem cells fall apart. So
Right.
that's why you got to keep what stem cells you have healthy.
Yeah.
And the best way is, like I said, fasting, blueberries, nutrition, vitamin D.
Yeah, you also brought up blueberries. Now, blueberries have a high concentration of resveratrol, do they not? And haven't studies shown that resveratrol is actually very beneficial as an anti-aging supplement?
Yes, resveratrol, blueberry, mountain berries, raspberries. But you can't say that because if you say that on Google or YouTube, they'll take it down because it's not a vaccine.
Right. It's not
against their agenda.
No, I totally understand that it's not a vaccine, but the thing is, if you follow resveratrol for years, it's almost like the French paradox, where they drink a lot of wine.
It's a natural vaccine,
if
you will.
A natural vaccine, right? And this is what your arguments are, is to improve your immune system, because obviously if your immune system was like a 0 to 17-year-old, this thing wouldn't even be an issue, would it?
Hey, listen, so in the US, all births in OBGYN are done on a flat table, which makes no sense at all. In nature, how are baby animals born?
Drop.
They drop from gravity.
They do. Eggs drop from gravity. Everything's born from gravity except in the U.S. Women.
To give birth standing up, and you grab these ropes, and the baby would plop out because gravity would assist you, and that makes sense. But now, here's what I think: why it's done on a flat table, because you're not going to have gravity to assist you. So the OBGYN is going to say, "Oh, we have to do a C-section."
Right.
So they can charge you $5,000 or bill the insurance. Here's what's the problem with C-section birth. If a baby does not go through the birth canal, the vagina, natural birth, they don't get all the mucosa in the digestive tract, the placenta, the vagina, which has a lot of the immune factors. So a C-section birth it's sterile. The baby doesn't pick up all the microbiome by going through all the tube, which is your intestines, and through the vagina. What's going to happen, the baby's going to have a lot of autoimmune disease, no immunity, and they put them on milk formula. Who's a dog? You gotta pacify that dog. Put it on a mute or something.
Dog. Who's got the dog?
Very,
You
very
gotta mute it.
rightly
Yeah.
said. You-
So you put them on milk formula. It doesn't have colostrum, which is in mother's milk, which is more immune factors. So already you're setting up the American baby for a lifetime of autoimmune disease. And what is the solution? Oh, once they're birthed, you have to have this vaccine, right? Which, by the way, takes many years for that baby to develop the immunity for the pathogens they put in that vaccine, when they need to start out with a natural birth and natural milk formula, which they don't really promote, you know. They just want to put a vaccine in there. Well, you can't go to school until your child, public school, until your child has this vaccine regimen, all right? And now what I'm afraid is they're going to push this vaccine agenda that say, oh, every American, everyone in the world has to have this supposed COVID-19 vaccine that they'll mandate. If you don't have it, see, they're going to put a tattoo, or Bill Gates wants to put like a tattoo or some type of chip in your hand so they can monitor to see if you have had the vaccine. And if you don't, you cannot do financial transactions. They won't let you in public places, which is unconstitutional. And it goes against the Geneva Convention. What happened in World War II? Germans are like, okay, all Jewish citizens, we're going to put a tattoo on your arm. And it's just a new public law policy. And people are like led to a lamb to slaughter. Because, oh, you're going to go on a train, and we're going to take you to this resort. Oh, you're going to have a shower. And they gassed 14 million of them.
But
not to mention, yeah, I mean, what is the country going to? If you don't think about these things, you're going to be a lamb to slaughter.
Yeah, we really don't.
We need a grassroots approach to say, hey, vaccine is not the answer. It's your body's own immunity. I have not heard anything from Bill Gates or Bill Gates is not even a real doctor, first of all. He's in IT, computer technology. Who is he to be the spokesperson for the WHO? Because the World Health Organization, he's the biggest fundraiser.
It's
Right.
money.
Now, why did
Again, it's
why
about money. It has nothing to do.
if you look at his interview, he's stuttering the whole time.
Why is
about this-
Giuliani
yeah.
assigned the science advisor of the president? He's not a scientist. He was a politician. It's about money.
And even Fauci, he's the one that falsely said that HIV causes AIDS. No, it does not. He did it. He was invested in the AZT, the antiviral for HIV. I mean, that's, you know, the guy.
Oh, apparently, Doctor, he's frozen up just a minute.
Dr. What do you?
But he has a point on not everybody needs to be vaccinated. I mean, if you're over age 60, I can see that you should take the vaccine. But if you're under age 60, do you really need to be vaccinated when the mortality rate is probably less than just a regular flu? It doesn't make sense to say, hey, I'm going to vaccinate an 18-year-old. That's kind of ridiculous.
It's just like telling everybody has to stay inside. No,
yeah, sure.
If you're 65 and older and immunocompromised, yes, you should self-quarantine.
Of course.
But if you're under 40, if you're in the working force, strong immune system, strong lifestyle, you're not a smoker, you don't have diabetes, you don't have heart disease.
Right.
You should be in the workforce.
Right.
And you want to get infected, so you develop the antibodies.
Then you build the antibodies.
Fight it. Yeah.
Correct.
Like the flu virus.
Exactly.
Everyone gets it. There's a new strain every year.
Exactly.
And
correct.
guess what? You develop the antibodies. That's your natural immunity.
I totally agree. If you're like under 30 and you didn't get vaccinated, but you got it, but now you developed the antibodies and you basically were self-vaccinated. Why give a person under 30 a vaccination? It doesn't make any sense. If you're over age 60, it makes sense. And then if you're uncompromised, but see, my fear is what you're doing, it's going to be one solution for everybody. It's just the same thing when they did the quarantine, one solution for everybody. And then the vacuum cleaner person only has one person walk in a day, gets X'd out when Costco and Walmart are out making money. It doesn't make any sense because the government usually has a one solution for everybody rather than having a correct solution for everybody. In other words, because it varies. So,
well, this is not going to be solved by government. It's going to be solved by small business like us, which is 78% of the economy. We're gonna be the innovators. We're the ones doing a grassroots approach like this podcast to educate the public. Don't let them brainwash you that everyone has to self-quarantine. Everyone has to take this vaccine. Yep. You know, everyone needs remdesivir. You know, it's like, come on.
Hey,
maybe
cholesterol, right?
Resveratrol, not remdesivir, which still has a high mortality rate. So I'm like not impressed. You know, other than Gilead Sciences.
We have to approach this just like what we were talking about earlier with Dr. Zhang, which I greatly appreciate that he came on and shared some of his frontline experiences with treating actual patients. And I think we just have to take each one individually. And if you know, like he keeps saying, please stay at home, use the phone. This is Dr. Sagu as well, right? Dr. Sagu and I, we preach this. And but stay at home and use the phone, call your doctor. Approach it with, you know, based on your symptoms, you know, what stage are you at? And then go to where the doctor tells you to go. I think each person, when I read some of the documentaries that are going on right now on Facebook, some of the documentaries have taught us that it's a very painful in the lungs symptoms, and that they all talk about how they lost their senses, right? Their senses for smell and taste. And I think once you reach these stages, if you're not calling a doctor, something is very wrong. Education is going to be the most important thing. Human intelligence, to me, beats artificial intelligence any day of the week. If you have the knowledge of what's going on, how it attacks your body, and then like Dr. Yu says, protect your body, right? And we talk about wearing masks and the proper PPE equipment. And these things are necessary during necessary situations, but we can't live like that. Our human race will not live like that. We've already seen a revolt going on in our country, and Trump supporting them. And, you know, my thing is, it's fine. Y'all go get together, get the disease and get over it, you know, but don't sit here and come crying to us about getting, I look at other countries and, you know, Australia is flatlined basically. Now they're preparing re-entry. India has a control over their situation. When I look at Australia only had 70 deaths due to COVID-19, I'm just flabbergasted. I'm embarrassed. We're supposed to be the smartest country in the world, and we're treating our doctors and nurses at the front line like they're worthless, and we're behaving like children. And then we've got these beautiful doctors that are on the show with us every day, providing us solutions. And the best solution of all, hydration. Right. I don't think any of us do this enough. I see Dr. Yu is drinking his drink, and Dr. Jatin is, you know, I've seen him a couple of times. Hydration, people, no matter what it is, water especially is probably the best thing we could do for our bodies. And then, you know, eat the blueberry. I eat blueberries all the time. I crave them.
Yeah. Well, what Dr. Yu is pointing out, which is really important, is boost your immune system. Because if you did have an immune system like an under 30-year-old, you would survive this, even if you got it. And some of the people, the problem is they're asymptomatic because they have it, but they don't even know they have it. But they only got little sniffles because they're under age 30 with strong immune systems. When you get older, you don't have those.
Curious, is there? I don't ever hear about sniffles coming with this or sneezing,
or whatever they have, a sore throat.
No, I'm curious though. Does that come with it?
But there's so many people in this country walking around with it, but they're young people, and because they have such strong immune systems, it just doesn't faze them. And so the thing is, one of the key things, and I totally concur with Dr. Yu, is you've got to boost your immune system. And if you can't, then you need to quarantine, because there are some people that they're not going to, like I said, you can't reverse your age, and you can't get rid of certain underlying conditions like asthma and diabetes, but you can reverse a lot of that, as you well know. And Dr. Sagu is a bariatric surgeon, there has been studies that when people do have bariatric surgery, that they actually reverse diabetes. Would that be correct, Dr. Segud? You have to unmute him.
I'm trying. Hold on. My computer does not work the best with me. Hold on.
Just make so since ages we are doing the bariatric surgery, and it was done openly and now the laparoscopically. And now what we have seen by the bariatric surgery, there is a definitely improvement of metabolic syndrome. That is not only the diabetes, it includes the hypertension also, it includes your hypothyroidism also, it includes your infertility also, and it includes so many things which are included in the metabolic syndrome. So actually there is a big relationship between the brain and your gut, that is the digestive system. So basically, diabetes is not because of the pancreas, it is because of mismanagement between your brain and your gut, that is the digestive system. So because of the hormone imbalance, the metabolism has slows down. And when we boost up the metabolism and we increase the sensitivity of the insulin by doing the bariatric surgery, so definitely there is improvement in the diabetes also, and you get a lot of good insulin and good response of the insulin and other things also. Because adipose tissue itself, it creates resistance to the insulin. So you have insulin. What is there in the diabetes? You have an insulin, but that insulin is not effective to work on your cells. That insulin is not enough to send the glucose into the cells. So when there is a bariatric surgery and there is upliftment of all the hormones, it may be ghrelin hormone decreases, it may be some other hormones. So there is increased sensitivity of the insulin, and the insulin starts working. When the insulin starts working, your diabetes is gone.
Right. Yeah, and the thing is, that's the studies that I've read. So the thing is, so you're continuing doing bariatric surgery because it helps people become more immune to the coronavirus, right?
Yeah. So in the meantime, in these 2 months, we have stopped doing bariatric surgery now for the elective patients, and I think within 2 months, 2-3 months, we are going to start surgeries again.
Sure.
And definitely, I mean, this also boosts up the immunity as well. It flush out your toxins. It flush out your bacteria also, and it maintains the normal micro biota of your gut. We have thousands, millions of some bacteria, good bacteria in the gut, in the digestive system. So if we can maintain that, that will also provide us the immunity, and that also boosts up the immunity.
Right. Yeah.
I'm curious in some essence about stem cell boosting. Is that something we can inject ourselves with, or is that something that, I mean, how does that work?
Well, the best, like I said.
Yeah. Tell us how stem cells work, because I missed taking stem cell 101 in college.
I'm just curious. He's talking about it building our system to fight the COVID, but I heard you and Tommy talking about stem cell therapy. Tommy went to receive it. I don't understand how it is received.
How does it work?
How does it work?
All right. So the way stem cells work is, let me get my presentation up here. Can you see my screen?
You got to share it.
All right.
Press share screen.
All right. Here we go. Let's see if my sound is activated now. There you go.
I missed taking stem cells in college and high school, so I missed.
There you go. Yeah. Well, guess what? Medical doctors also have missed stem cell biology because they get 0 hours of stem cell biology, and that's why in medical school they don't teach this. All right. It's all about, you know, if you have this drug, if you have this symptom, you have this drug. All right.
Sure.
So a stem cell, like I said, is something we're all born with. And there are embryonic stem cells, and those are stem cells before you're born. All right. And they're more what's called pluripotent, which they could change into more tissue. The problem with using embryonic stem cell, because they're more primitive and they could change into a more wide variety of tissue, they could theoretically cause tumors or cancers, right? So we use adult stem cells like shown here. That's from the umbilical cord, because those stem cells can only differentiate in several different types of tissue, all right? And one of them is it boosts your T lymphocytes, which is your white blood cells, and natural killer cells, which are immune cells to kill viruses, all right? As we can see, compared to all the human cell tissue products, you can see we have umbilical cord blood, which has hematopoietic stem cells, which are blood-forming stem cells, red blood cells, white blood cells for immune system. And we have umbilical cord matrix, which is Wharton's jelly. That's the surrounding, it's the membrane of the umbilical. And that has the richest source of what we call mesenchymal stem cells. And those are the type of stem cells they used in the China study to reverse the COVID symptoms in those patients. And this is the study that a lot of US labs have gotten rapid approval for the FDA to use that to enhance the immune system to treat the COVID virus, all right? And like I said, a lot of athletes, this is their kind of secret sauce to keep them, vibrant. Here's a study where they put stem cells in a flask, and because of the second law of thermodynamics, they tend to spread around, right? Entropy energy. So you don't want to just put stem cells in your body and they wander around. You want to get them to the target tissue. Like, let's say you have knee pain, all right? So how do we get the cells to your knee? Well, to answer Kim's question, we would inject it right in the knee, and then we would laser the knee, and the laser would attract the stem cells kind of like a light glue, so it stays in the target tissue, and the cells will align to where it is. Another thing we're doing is exosome therapy, and see this big cellular wall? That's a stem cell. It's pretty big, all right? Now, exosome is a particle within the stem cell. Those are those little droplets, you see them with the arrows that are going out of the cell, and they go to the target cell. And these exosomes are very small. They're about 150 nanometers, which is about the same size as the COVID virus. So theoretically, if you give somebody these exosomes, you can IV it or you could inhale it. And if you inhale it, it will go to the lungs. If you IV it, 90% of this or umbilical cord blood will go to the lungs where you want it to go. And what it'll do is these exosomes or umbilical cord blood growth factors will compete with what's called the ACE2 receptor. And that's the receptor. It's like a lock and key mechanism. You know how the COVID virus is it's like a spike, right? They got the spike proteins. Right. Those proteins attach to the receptor like lock and key. But if you put exosomes or umbilical cord blood, those stem cells or exosomes will attach to that ACE2 receptor, preventing the COVID virus to attach so it cannot replicate. So this is now do you all understand why exosomes and mesenchymal stem cells can not only kill the virus, but they compete for this receptor so it can block the virus from attaching to it and replicating more virus cells. Does that make sense?
It does make sense, but is there anybody using that therapy or treatment in the United States?
Yes. So there's a company called Cellularity, and they got rapid approval for using placental tissue with natural killer cells for the COVID. There's another company which is applying for to do a rapid approval IND study using umbilical cord blood,
right?
To manage the virus. There's another company using the Wharton's jelly, umbilical cord membrane. So yes, there are a lot of studies coming out. I'm involved with many of these companies, so we could hopefully get involved in a study so we could provide this in our clinics to our patients as well.
Right.
So yeah, this is very, very exciting, and there is more media coverage on how countries are using stem cells to fight the virus as a natural immune therapy, if you will. So there's another doctor in Las Vegas I'm working for. I'm trying to get him in on the podcast today, Dr. Bill Sin. And Dr. Sin has developed a method to take your blood, so to get your growth factors like PRP, mix it with umbilical cord blood from a donor, and put it back inside of you, and that will compete with the ACE2 receptor to block the COVID virus from replicating. I'll make sure he's in on this part or the next, so he could talk about his technology.
Yeah, I mean that would be something I'd be interested
Yeah,
in.
Dr. Wu.
Dr.
Dr. Wu, nicely presentation of your stem cells. I know this is the raw material which is being converted into the adult cells later on. But for the therapy of the COVID-19, as you said, that you're using the axonal or some stem cells, they bind with the spike receptor, which is the key for the corona, and then the COVID-19 cannot attach to the epithelial cells. Are these cells being extracted from a recovered patient? If it is from the recovered patients, then they may have antibodies, and the antibodies, it's a proof theory that if you have antibodies, the antibodies can bind to the spike protein, and they can be, they can avoid the COVID-19 to be attached to the epithelial cell. So, is it an antibody or it's a stem cells?
So, I think both is the answer, because if you have somebody who tested with the antibody test, they tested positive for IgM and IgG antibodies. So what that means is, think about it like this: IgM IgM is I get McDonald's. It's fast food. That means you've had the. That means you've had the virus for a long time, and if you're tested positive for both, guess what? You've had the infection, you've developed the antibodies to fight it. Then you could donate your blood through plasmapheresis, and that'll give immunity to other. So it's both. If you don't have the antibodies yet, you can use the umbilical cord blood to develop immunity. If you already had it, you can get it from a donor, right? And then you will be immune to it. So yeah, those are the natural solutions that make sense. Yeah.
So that is the basic principle of plasma therapy. What we are doing, we are extracting the IgG, and those IgG is being injected into the patient, and those IgG that is specific for the COVID-19, and they can compete with the COVID-19, and the COVID-19 can be killed off. Yeah. So that is the basically plasma therapy.
Once the IgG tests positive and IgM is gone, you have the antibodies, and it's safe to donate your blood. Yeah,
you're safe. You're safe because IgG is the chronic protein and IgM is the acute protein. So if you have
IgM McDonald's, it's the fast protein, fast food, IgG gourmet.
Yeah, if you have IgM, then you are still infectious. But if you have IgG, then you are not infectious. You can donate your blood.
There you go. Yeah. So if you test for both IgG and IgM, you need the umbilical cord stem cells, and so the stem cells could compete. Use your cell as a machine to make more virus, zombie cells. So yeah.
Yes, Dr. Aja.
Yeah, thank you very much, Nicola. So what you has presented so far, I think it's one of the latest technology, and it's a very nice presentation. And what I want to add is, if the patient is not being infected and he has not developed the antibodies so far, so pluripotent stems, what they're going to do is they're going to convert it into the natural killer cells, the NKT cells, what we called as. So they are the cells which are the first line of defense in our body. They are provide the innate immunity.
Innate immunity.
So even though we have not been, acquired this virus ever before in our life, we have not developed the antibody in our body. So innate immunity plays a major role by producing the interferon gamma or interferon, interferon beta also. So they are already in the, the trials that can interferon be of help. So NK cells, those who have been, developed from the newer pluripotent stem cells, that can be of first line of defense, and that can attack the virus in a better way. What I can
umbilical cord blood is rich. It's rich in IL-37.
Yeah, sure.
Which is
Yeah, Dr. Jatin, I would like to ask you one thing. As you
Yeah,
said,
sure.
the NK cells and the interferon gamma. So, don't you think these NK cells, interferon gamma, interleukins, they are non-specific immunity, immunity, and they are less stronger than the specific immunity. If you have a specific humoral, it may be natural, it may be artificial humoral immunity.
So what we do is whenever we talk about the immunity, the first
Yeah,
part is
for
not.
COVID-19.
Yeah.
I'm talking about for COVID-19.
Yeah, I'll cover on COVID-19 also. So you what say? If the patient is non-immune, patient does not acquire any kind of infection, even if we start talk about the COVID-19 also, the,
Yeah.
the first line of defense of everybody is the
Innate,
innate
yeah, that is the
immunity.
innate. That is the innate immunity.
Okay,
Yeah,
that is
that is the
non-specific.
innate.
That covers every kind of infections,
Yeah, that is
any virus. Yeah, that is
so.
non-specific,
Let
and it can be by our natural killer cells only, the T cells. But if you talk
yeah, yeah,
about the specific immunity, it is divided
yeah,
again to two parts. One is the humoral part, which is the
yeah,
antibody driven, and the second
yeah.
part is
Cell
the
mediated immunity.
T cell, the T cell mediated immunity. So
Yeah,
in with Dr. Philip has already mentioned about that pluripotent stem cells. So how they
yeah,
gonna play is because since they are not patient who is taken from the non-immune persons, so they can
yeah,
be acting as a natural killer cells. If they are
yeah,
from the patient from the immune persons, they can act
yeah,
in both the ways as in
yeah,
natural immunity, no, sorry, innate immunity as well as
yeah,
in the form of a T cell mediated immunity. So that will be a
yeah,
further boost up to the body.
yeah, 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 yeah.
Yeah. So as we're all saying is, I think we all agree that your
I think your voice is
endogenous stem cells or from a donor is absolutely the solution. So I don't know why America's sitting on their hands saying, let's wait until the vaccine's invented. It's ridiculous. And then if you say on YouTube, Federal Trade Commission is going to shut you down for saying that, which is ridiculous. It's like they want to suppress this natural information so they could push. They're not going to promote something that competes with the big pharmaceutical company. That's the bottom line.
So as this COVID-19 pandemic unfolds, we have a lot of investigation therapies in our hand. And since now we have the convalescent plasma. Initially we have hydroxychloroquine, then we move on to remdesivir, then we have the convalescent plasma. Then now, as you told about the newer therapy like the stem cell therapy, maybe in the next 2 or 3 months, as this the pandemic unfolds, we have more robust data on any kind of specific therapy. But as you already mentioned, Dr. Yo, the immunity playing our self immunity, natural immunity is going to
Yeah,
play a major role. No matter what age you are, but definitely yes, the younger are more protected. The
yeah,
the older one, little bit of more risk of getting the severe disease. But you cannot compromise with your natural immunity boosters like getting as you
Yeah.
told about the blueberries and all those
yeah, yeah,
natural
yeah,
immunity
yeah,
boosters.
yeah.
You have to
And
take care of it.
another problem is we lack testing. Only
Yeah,
1% of Americans have really been tested. So there's probably a lot of more people infected that we don't know. And what's the CDC doing? Oh, you have to go to a certified, testing site, and they're going to limit access. I mean, the solution is like in Korea, they have testing sites everywhere, and they swipe your nose, you get a rapid test, and if you
I think your voice has again gone, but I'll tell you that yeah, it varies from country to country. So testing capacity, but for as a generalized rule, if you talk about the WHO protocol, test, isolate, and treat. Test, isolate, and treat.
Yeah, just
That is
isolate, treat.
it's
Right.
yeah.
it's 17th century draconian
he's knocking the American health system, which, by the way, is the most expensive health system in the world. We spend $2 trillion, almost $2 trillion a year on our health system. So one thing we do know, we are the most expensive. But in terms of being the leaders in overall health, I don't see it. You know,
the solution is a rapid test kit,
right?
Like a pregnancy test or an insulin test or cholesterol. You just prick your finger. You do it at home.
Yeah.
So we have these rapid test kits, but the FDA is saying, oh, it has to be done in the clinic. So we're doing it at the clinic, and it has to be under a study, right? So let me show you a video of how we do the tests in our clinic. All right. So let me say, can you see my screen still?
You got to share your screen.
Dr. Philip, I would like to mention a comment here that rapid testing it has more false negativity. I mean, it will not be positive in the initial mean incubation period. So for the mass gathering, if you want to trace the context, rapid is okay. But if you want to treat a patient, if you see the prognosis, then RT-PCR based test is good because you can see the viral load in that test. For antibodies test, it will not tell you the exact prognosis of the treatment and the diagnosis of the treatment.
Yeah, you're absolutely right, Dr. Sagu.
Hello.
As far as India is concerned, India has already mentioned that it is not the test for the diagnosis. But it is the test, those who knowing that the patient can be already been gone positive, but now they are out of infection. And second thing, they can be utilized later on as a part of a convalescent therapy.
Yes, that is why the only two benefit of rapid test is if your patient is positive for the rapid test, you have a good amount of the IgG, then you can keep those patients for your work. You can use all of those patients to build up your economy because they cannot be have a reinfection rate is less. Number two is you can keep all those patients who have a good amount of IgG as a potent donor for the convalescent plasma therapy. So it's good for that, but it's not good for the treatment of the COVID-19. For that, you need to have a RT-PCR therapy, RT-PCR diagnosis only.
That's a gold standard.
Okay, could you see my screen yet?
Not yet. You have to share it.
You're gonna have to. There you go. We see it now.
Yeah.
All right. So I'm going to show you how we do the test. All right. You hear the aha music?
Not quite. I love aha though. Thank you. Take on me. I love it. It's my favorite.
There you go. Can you hear the video?
No.
Well, you see me speaking, right?
Yeah.
All right. I'll just explain what's going on. So, a disclaimer is this is not a definitive test like Dr. Sugu was saying. It's just a screen to see what type of antibody reaction you have, so we can decide if they need the stem cells, they need to boost their immune system, they need to self-quarantine, or they could get back to work, right? So you want to make sure that you got enough blood flow in the hands, because a lot of people have poor circulation. So you can use a hot compress. I like to use a light-emitting diode lamp, and that brings blood flow to your hands, right? And then we do a finger prick. This is a test kit right here. And you prick the finger to get a drop of blood, right? And then you wait 10 minutes, and then you'll get a reading from the reagent that you mixed with the blood. And this person is negative, all right? So he has not been affected from IgG, doesn't have any IgM antibodies. For this patient's recommendation is just what we talked about. Keep your immune system strong so that if you do get infected, you'll have the immunity to fight the virus.
Yeah.
If they do test positive, they got IgG but not IgM. They've had the infection for a while. They've developed the antibodies. If they're symptom free, they could go about their business. And those are the people who could donate their plasma, and they could use as immunity for others. If you have IgG and IgM, you need to self quarantine, and you need to have the stem cells to block the angiogen 2 receptors. So those are ways that in the clinic we could do a rapid test. It just takes 10 minutes, and it's scalable because we get done at the doctor's office, done in the parking lot, through a drive-through. We can send a phlebotomist to your home, do it in your home. But eventually, we need to have it where you could do it yourself. It's very simple. You know, if you could test your own cholesterol or blood glucose with a prick, you should be able to do this test at home as well. And then that way we can test all, 360 million Americans, and we can suppress the virus faster instead of guessing. Right,
yeah. If the rapid test is negative, there are three inferences. Number one, patient may not have an infection. Number two is patient may have infected, but there is no IgG in the blood. Number three is patient may have infected, but the immune system is severely depressed. He or she does not have an immune system. So if the rapid test is negative, it does not mean the patient is not infectious. Patient may be infectious. We have to confirm it by the RT-PCR test.
No, I agree. I agree with that. I think that, and I also agree that we can't just depend on them 100%. We could get false reports. We do know that there are some false reports. You have to rely on some common sense with this. You don't just take the test and you go, okay, I'm safe. I can go out and just be reckless. It's kind of like, I mean, excuse me, people, it's like having sex. You're just not going to go out and be reckless, right? If you get tested routinely for diseases and stuff, you still take caution in what you do and how you engage sociably. I think we need to be very, very careful because we spend a lot of time protecting ourselves and putting ourselves in isolation to be able to isolate the problem. And to sit here now and go, okay, we can go out and be reckless, I think that's just a poor decision at this point in time. We're all restless. We all want to get back to our normal lives. I don't think there's going to be a normal like we used to know. I think we've been talking about this with our new, so, we're going to have to constantly be washing our hands, keep them away from our faces, learn more about how you sociably engage with people. But because HIV taught us this, right? With how we engage in relationships with people. So I think we've got to look at this test being one stage, but I think it needs to be more than that. I think we need to just be constantly testing our immune system, and we need to be focused on building our immunity. We need to be focused back on bringing peace in our body, getting out and getting healthy, getting the vitamin C you need every day and the vitamin D. I go out because of Dr. Yu saying this. I go out and sit out in the sun every day. The sun is out, and I even open my mouth. You got to be careful because flies might fly in or gnats. But I get out there and I absorb as much of it as I can. It's healthy. It's healthy for your mentality state. And I think that's where we need to get back to. We need to get back to originally what nature wants us to be. I think all too often we try to be something we're not. And Dr. Yu, you said this when you first came on the show, and it really impacted me. We're hunter-gatherers, right, by nature. But I think we fight the nature every day in trying to be something we want to be rather than something we need to be. And there's Sasha.
Namaste.
Namaste, Sasha.
Namaste. Hello.
Which, Sasha brought us a lot of fun yesterday, something natural and fun that we could sit around our homes and not go out and engage and be in contact with people and play a game and still have fun. And we got to do this. How are you doing today, Sasha?
Very good. You know what? I've got a printout of yesterday's event. Now, printout means they had all people by names, a lot of people from Latin America, a lot of people from Europe, um, of course, North America. So we had quite a diverse demography of the event. Then you could see who put how many crowns on each move. So you can, it's like it's like anatomy of the event. You see exactly what each one contributed and how each one handled his crowns and the results, and everything is right there. It's very, very interesting.
But it was something fun and it was engaging, and we got to meet people and hear people. We had music, we had conversation that was casual and inspiring and educational. Yeah, there's Ankit. And so on top of building our immune system, we got to build new social habits, right, Dr. Sagu?
Can you please repeat your question? Yeah, please.
So
Okay.
on top of developing our immune system, we're going to have to develop new social habits so that we can get
Yes.
to our life.
Yes.
And what are some of the social things that we need to start doing so that we can stage ourselves back into society slowly? We don't want to rush it, right? I don't want to go out there and get reinfected stage.
Yeah, to develop the immunity, it's very important to have a good habit. Number one, your diet has to be very good. You should take a healthy food. And number two, if you are taking alcohol, the smoking, you have to avoid the alcohol and smoking, because both of these things, they are going to decrease your immunity. Number three is, if you are having good sleep, it's okay. If there is any sleep deprivation will lead to decrease your immunity. So at least you should have a good sleep, that is 7 to 8 hours. Number four is, you need to have a stress free. You have to top up on your stress. Do some stress busting activities and keep yourself away from the stress. That is important. Number five is, do some physical activities, because the exercise is going to increase some sort of hormones like cytokines, interferons. They are going to increase the blood flow, and when there is increased blood flow, they are going to increase the circulation of your natural immunity cell, that is the T cells and NK cells. So exercise is very important. Keep yourself calm is very important. The diet has played very, very good role. You should have less of the carb. You should have a good protein in your diet. You should have a good fat in your diet also. It doesn't mean that you should stop taking fats. And the role of the vitamins, the minerals is very important. You should include in your diet vitamin C, vitamin E, vitamin D, and B12. These four vitamins are very important. Then you should include your minerals. Have a good healthy diet so that you can have more of iron, more of selenium, more of calcium. So these minerals are very important to boost up your immunity. So the effect of the environment is also very good on your immunity. If your environment is pollution free, if your relationship in your family is very good, then you have higher immunity. So this is the crisis time, when there is no absolute treatment for the COVID-19. This is only the immunity which is going to play a major role in the defense against the COVID-19. So basically, this is a defense army of your body. So you should boost up your soldiers. Your soldiers has to be very strong to fight against the COVID-19.
No, I agree with you. I think those are some excellent.
Yeah.
Because
and the role of the hydration.
It's good habits. Just getting back to good habits.
Yeah, you mentioned about
keep yourself hydrated.
You mentioned about water. I heard another podcast that water has different molecules in it. It resonates at different frequencies. So you can have healthy water, and I heard hydrogen water is very healthy.
Yeah,
and you should put your water in sunlight, because the sun, it has electromagnetic spectrum that will make the water molecules more healthy for the body. So, and you don't want to have your water near like negative energy, like harmful electromagnetic fields, like by your computer or the microwave. It'll make the water, unhealthy. So yeah, even water itself, it's almost like a living molecule, and it wants, natural, more healthy energy frequencies from the sun, the electromagnetic field from the earth. So you should really drink your water grounded, barefoot, on the dirt and grass, in the sunlight, and these are all free. So we need to get back to the basics.
It is free. And I enjoy that. And somebody mentioned about reducing alcohol. We talked about reducing alcohol and smoking, but we made those our necessary stores. So those in America are open, necessary truths. But we've got a question from Sasha.
We are counting as essential services now.
Speaking about water, there is one story I've just heard about a few days ago. It was on a game show. The question was, there was a 19th century English gentleman, very wealthy man. He had 3 daughters and he loved them all. And he built a new mansion. And one particular thing was very unusual at that time. That in a bathroom, in a bathtub, he had 3, not 2, but 3 faucets. So supposedly the left one was for hot water, the right one was for cold water. Now, what tap was in the middle? What for?
Lukewarm water.
You may say that, but in fact, it was rainwater.
Wow. Yeah, it has the electrons. It's like after it rains, you have negative electrons, which is healthy for your body. And it's kind of like ozone. You get a lot of ozone after it rains. That's why the air feels very clean. So in our clinics, we're going to get some ozone generators, and it's going to clean the air. So yeah, exactly, rainwater. But the problem with the water in the U.S., it's poisoned through the chemtrails and the smokestacks. So if you can find out to filter that rainwater, like I said, this is all free. But yeah.
There's a system out there that I'm aware of. Keep talking. I'll look it up. H2OPE.
So hydrogen water.
Well, there's various different kinds of purification systems, so things that you could put back in your water that are actually good for anti-cancer and purified alkaline water.
Your stem cells work better in an alkaline environment. When you have arthritis, inflammation, then if you have a pH in your blood and water above 7, you're going to have more inflammation in your body. So alkaline diet, alkaline water is the best way to enhance your body's stem cells to make a environment where they can proliferate more. So, but most water is acidic, especially in the U.S. Bottled water has the plastic leaches in the water. So we need to find alternative to plastic. Carry your water in glass, which is it's more inconvenient. But the best way to hydrate yourself is really not water. It's through organic fruits and vegetables, which have a high water content. I think there's some gels that you could take to hydrate your body. Mm-hmm. If it's acidic, hard water that's lacking good balance of minerals, it's going to leach all the minerals out of your body. You got to drink more water. Guess what? You're more dehydrated. So it's ironic, right? Yeah.
So even the alkaline water will prevent you from the infection in your urinary tract, in your kidney. So to prevent the UTI also, alkaline water is very good.
It melts the stones, the acidic stones in your kidney. Yeah.
Yeah.
So.
There's a gentleman in the Vegas area that who produces water at various different levels of alkalinity for people to come and buy. And you bring your own glass containers, like it's a water shop. It's really cool. And he's got different kinds of filters. He filters out the water, cleans it. He's got ultraviolet rays that help kill certain things that are in the water. And but I like the fact of the alkalinity. Yep.
If you talk to any farmer, fruits and vegetables,
so much.
Vegetables grow better with you use alkaline water.
Yes.
So it just makes sense that your stem cells are going to proliferate more. Body's going to work better in an alkaline state. In fact, cancer cannot proliferate in an alkaline environment, and that's why cancer is the #3 killer in the U.S. because our diet's acidic, our water's acidic. There's too much GMO, genetically modified foods. Too much DDT, Roundup. Glyphosates. In our vegetation. So there are consequences to all this. The mass marketing from the food industry, injecting animals with hormones. I mean, that's going to get in your body. Too much drugs. The average American takes 26 pills. So you urinate all these drugs, you flush it down your toilet, it gets in our water system. Guess what? You're drinking it. So you got to have a filter to filter out all these drug particulates that gets in our water system.
Yeah.
So yeah.
So I have a question for Dr. Philip. That as you said that we are taking a lot of pills during our lifeline, and while we are at a stage maybe around 60 plus, we have a lot of symptoms of some kind of disease or something going on because of the body and the shape and the amount of work we have done so far. So those medicines which we have taken, those are the precaution medicines at that point of time. But is that possible that those will impact you at some point of time because you are taking a lot of medicines?
Yeah, when you take, let's say you take an antibiotic or you take a pain pill called an opioid, what happens is your liver will detoxify it. It'll be digested, through your system, and you're going to urinate the chemicals in your toilet from the drugs, and then you're going to flush it down. It's going to get in your water system, and most developed countries have water processing, systems. They try to get all the toxins and poisons, purify it. Unfortunately, they use chlorine, which is going to poison you. So you got to have a water filter to filter out the chlorine. That's why you should have a filter to filter out your water that you bathe in, because when you shower and there's too much chlorine in your water, it becomes gas, and that's going to poison you, right? It's almost like the gas they used, the Nazis, when they gassed all those people. They used a certain chlorine-based chemical, which is, anyways. So when you flush the drugs down the toilet or you urinate the drug particles, it gets in your water system, and then you drink it, right? Because you can't detect these micro, chemicals, and you're going to have a lot of dangerous side effects, autoimmune disease, probably cancer, neurodegeneration. It's gonna disrupt your gut microbiome, causing dysbiosis, and 80% of your immune system's in your gut. Like Dr. Sagu is saying, well, diabetes, and then we have like Parkinson's, Alzheimer's, is all caused by gut dysbiosis. The vagus nerve is in your brainstem. That's cranial nerve number 10. And that stimulates dopamine, which is in your substantia nigra pars impacta. That nerve goes down, it controls your heart rate. It passes through the nerves that control your heart, and then your digestion goes to the gut. Well, if your gut has bad bacteria, that bacteria is going to infect the nerve. It's going to crawl up, and it's going to dysregulate your heart. You get heart arrhythmia. So a lot of my patients with Parkinson's, they have a pacemaker because their heart rate isn't managed right, and they don't make dopamine. So the way if you want to protect 80% of your immune system, 80% of your immune system is in your gut. So we have a gut restoration program. It's a 3-phase program. Starts with spore-based pre and probiotics, because if you get the probiotics from the shelf at a supermarket, a lot of times it gets broken down in your stomach acids. It doesn't get absorbed in your intestines where it needs to go.
Yeah.
So you want to make sure it's surrounded by a spore, so it protects the probiotic, so it survives the gut acid and goes to your gut and is absorbed properly. So we have a 3-phase system that we put our patients on, right? So yeah, all this stuff, again, you don't hear it from the media, and if you educate people, and you got to make sure you have your disclaimers. If you can't say, oh, like I said, it's going to boost 80% immune system. You can't say this stuff, unfortunately. And then a lot of Americans and people in the world are not going to be educated. They're going to be brainwashed that, remdesivir, antiviral, or the vaccine's a solution. So that's the agenda to, profit these greedy pharmaceutical companies. So yeah, I didn't hear the World Health Organization talking about high dose of vitamin C increases interferon, which boosts your immune system. They don't talk about how zinc breaks down the cellular wall of these viruses. They say, oh, we need to see the safety studies. Well, guess what? By the time you're done with the studies, you're dead. People need it right now, So
I think, as Dr. Philip is mentioning, that it's all about this thing.
Yeah, even who's that famous American Indian Dr. Gupta? He's on the handsome guy. Yeah, he's not a real doctor. When has he seen a patient? He's a politician. He's the one saying, "Oh, we need to do more research on vitamin C and zinc and all this." It's like, hey, the patient needs it now. Come on, who are you trying to kid? Yeah.
I understand. So we have a special guest, Dr. Hari, joining us, and he is running a research lab in India. Namaste, Hari. Good evening. How are you doing?
Good evening. I am fine.
Can you please explain what you have done in the research lab and what you do, and where are you from, to our viewers?
We are a clinical trial company. We conduct clinical trials phase 1 to phase 4 and also bioequivalence studies.
And
we're going to have to do an umbilical cord blood COVID study in his lab.
See, at present, there are a lot of COVID-19 studies are going on all over the world. And right now, 2 studies already, enrollment is also started. And most of the people are focusing on the vaccine.
See, there you go. Because
yes,
that's why a pharmaceutical company, that's why they do clinical trials. And the problem is a lot of them, they fudge the data. They hide the side effects. And it's a very corrupt industry because they can bribe the FDA. They can bribe Congress to get these dangerous vaccines and drugs approved. Let's say the Tamiflu vaccine, that was approved, but it causes detrimental side effects. And, that was invented for the avian flu virus, the bird virus, which never really became a pandemic. So government stockpiled billions of dollars worth of Tamiflu from Roche Pharmaceuticals for a pandemic that never occurred. So that's why we want to do a study with umbilical cord blood. Problem is, a big pharmaceutical company, they're not going to invest in stem cell study because it's not profitable. You cannot patent it because you have to have the exact milligram dosages of drugs so you could patent it. Problem with stem cells is, depending on the health of the umbilical cord, the stem cell count is going to be different with each dose. So it's not patentable, and the drug company's not going to touch it. That's why it has to be funded by the private industry, patient-funded studies, or the stem cell lab, or from private investors. So, like I said, vaccine is not the solution. Let me tell you. Most of the data is manipulated. It's done through bribery. All the medical journals are run by ghostwriters, by the pharmaceutical companies. So I think it's great you're doing the test, but make sure they're not fudging the data. And if they are, they need to be called out on it. So
it's called data integrity. We very much aware about that.
yeah.
So in the study, data integrity is very important.
Yeah.
See, right now, what we have to look is that immediate solution is what, and the future solution is what. The immediate solution is we don't have any vaccines except hydrochloroquine, isn't it?
So hydrochloroquine is not really a vaccine.
It's not a vaccine. I'm talking about the drug. I'm talking about the drug. Right now, we have.
Yeah, it's not. It's not a patented drug. It's available to any doctor or pharmacist could order it and prescribe it. Problem is, see, even President Trump said, yes, many people are being helped with COVID symptoms with hydrochloroquine, a Z-Pak, azithromycin, and zinc. He said that zinc, which is natural. So we know he's not being, bribed by Big Pharma, hopefully. But there was a doctor in San Diego, and he was prescribing hydroxychloroquine. And you know what the Department of Justice did? They shut him down. And they said he conducted mail fraud for trying to help his patients. So like I said, in the US, they're trying to push this vaccine. Even if they invent a vaccine, it's going to take 1.5 years to come out. And by that time, the virus has already mutated. Right now, we already have 3 strains, A, B, and C. The strain that went to Italy, the reason why the infection rate is high in Italy, because the Italians have this genetic SNP that makes them more susceptible to the virus. Now, what research has shown is people with type B, if you have a blood type B, you're more susceptible to one of these virus strains, all right? Fortunately, if you're type O, like I'm type O, so I do good on a ketogenic diet, which I actually eat some grass-fed meat because you need that with a type O. Fortunately, type O, they have a lower susceptibility to be infected by the virus. So again, the vaccine is not going to come out in time. And even if it does, people don't realize that a lot of these vaccines have aluminum, they have mercury, which are neurotoxins. They have aborted fetus parts, which is unethical. So if they're going to put a vaccine out, by God, use the umbilical cord blood, Don't put all these harmful substances inside of you, which is unethical. And I know you're just a research lab. It's the pharmaceutical companies that need to be held responsible. What substances are they putting in the vaccine? So people need to know what they're putting in their bodies. I don't want aborted fetus parts in my body. I don't want aluminum. I don't want lead. I don't want mercury. I'm not going to have it. I'll go move to Mars if they mandate it in the U.S., before taking that vaccine. So that's what we got to be aware of. If they want to use a vaccine, use homeopathy. They put a little of the pathogen inside you to open immunity. You don't need all these fillers, heavy metals, xenogenic, preservatives, it's crazy what they're putting inside of you, So yeah, let's do a study in your lab with the umbilical cord stem cells. That's a solution.
Okay, yeah, Dr. Philip. Yeah.
Yeah, what do you think about that? That would be interesting. I mean,
let's put it this way. You're doing research on the vaccine. Would you put that in your own body as one of the clinical, subjects? Would you? Come on. These own manufacturers are not going to inject themselves with this stuff.
Right.
Because they know it's going to poison them.
Can you explain to us some of the things that are going on in your lab, or some of the research? Can you explain some details of research?
What about our company, IC Bio?
Yeah.
Yeah. So basically, we conduct any new medicine which has to come to market. It has to be tested and proved its safety and efficacy, which is what it is at present required for COVID-19 also. So what we do, any new medicine which comes, we do the phase 1 to phase 4 clinical trials and prove its safety and efficacy. How many subjects or a patient shown efficacy against that particular medicine. So it will not be done everything in our lab. Even we use the research centers where many patient populations are available with that. So if you want to do a therapeutic area wise treatment. So if you want to test a drug on COVID-19, we use COVID-19 patients and we see how the drug is acting on it. See here, very important thing is when it comes to the, let us talk about COVID-19. What does COVID-19 does? Our body does not have any immunity for this virus. This is a totally new virus. It doesn't mean that coronavirus is a new one. There are 4 types of coronaviruses are already available. You may be aware around 5 to 8% of cold and flu, what we get, it's due to corona only. Okay, so, but it's a new strain and the treatment options or many treatment options are coming, which are, we are using influenza medicines and what is called as the anti-leprosy medicines are getting used because there is no new medicines already identified for this. So at present, anti-leprosy drugs are getting given to the patients, those who are suffering from COVID-19. And in India also, there are 2 to 3 studies have been received a DCGI approval to conduct study on COVID-19 subjects. It's on a drug, not for the vaccines. Whereas Oxford University scientists are already discovered one vaccine. According to them, tentatively by end of October, we may get a vaccine from Oxford University scientists. So another point is very important is that corona is generated from China, Wuhan, and the same place they have also discovered vaccine, that is inactivated vaccines, and which are under clinical trial at present.
Yeah, so what I'll do is I'll talk to Dr. Sin. He's the one that developed the natural vaccine. We're taking your blood, combining it with umbilical cord donor stem cells to develop a natural killer immunity. It'll compete with the angiotensin receptor, so the COVID virus cannot attach to it. The stem cell will, blocking the receptor. So I'll have them contact you about starting the phase 1 trial. We just need the funding. That's the problem. Everyone wants to do a study. Who's going to fund it? So, and we're not a big pharmaceutical company, unfortunately. But I gotta go now. I gotta prepare for my virtual church service. So let's continue the discussion. Next to, I'll get Dr. Sin on the next talk. Okay.
Absolutely. Thank you,
All right.
Dr. Yu.
All right. We'll see you guys.
Blessings.
Bye bye.
Have a great day. So, yeah, he definitely shared some interesting facts about stem cell research, and I still agree that I think our greatest defense is our own bodies and building our own immunities. What are your thoughts on that, Sasha?
Okay, to tell the truth, I'm getting a little bit frustrated because we are going now on for several weeks, and we all agree that the personal hygiene, washing your hands, staying at home or being isolated, exclude any physical contact. Make it your immune system stronger. That's about it. That's all what you can do at this moment, really. There's nothing else you can do about it. There's no vaccine. There is no clear way of medication which will help you in case if you're ill. People are proposing different methods of doing this or that, and it's unclear which one helps and which one doesn't, and to whom maybe some people this medication will help, and yet other people there has to be different medication. But that's beyond your control. You have to be lucky to get to a good doctor who will make the right decision for you. And that's about all what you can do. There's really I wouldn't spend even 1 minute of my time to think about it for more. It's not productive. It doesn't get you anywhere. It's just a waste of your time, energy, and I think you can do something better with that. That's my thought.
I think first off, we know that there's not going to be a vaccine. There's there's no way that anyone can come up with a vaccine and we trust it in this short period of time. My research, which has been quite fascinating, with when the first COVID was ever identified, which was in 1964, by a woman scientist who, by the way, was not educated by college, right? Which is the reason why I don't think we ever saw her published like she should have been. But she's the reason why microscopes can operate the way they do, why we use and we're able to identify viruses. If it were not for her, we would never have found the means to identify certain viruses. And she identified the coronavirus, the first one back in 1964. And what she did was she recognized that it was also similar to viruses that she saw in the chickens, in their respiratory, and in a liver enzyme. And she did a paper on this, and they would not accept her paper for whatever reasons, probably political, and the fact that she did not have a PhD nor a bachelor's. But she is the reason why most of the people got their bachelor's. I'll guarantee you that, because if it weren't for her, we wouldn't have the microscope capability. But she found the first coronavirus, and they called it corona because of the spiky crowns that were formed around the virus. It was in a young child. It had a code name of in whatever. And that's when they first identified the very first virus. It was in a child who was having and struggling with pneumonia type symptoms. Don't know the outcome of the child back then or what they did. It was one of the first strains of corona. They said the reason why we struggled so hard with finding a vaccine is that's pretty much the only data we have to work with is data that we collected back in 1964. So, I don't think we're exactly the smartest generation for fighting viruses because when we get a temporary fix, we tend to go, okay, instant gratification, we're done with that, let's move on to something else and send people to the moon when people are still dying here. And then we also have that other attitude, well, it's only 3% people dying, why do we care? We care because of the way this is spreading and how fast it spreads and the impact it has. Once we understand how to treat it, like any other flu or any other virus in our life, like chickenpox, then we can address the next stages and next steps. But right now, if you get sick with it, when you went out to that mass party last night and you're out there protesting with Trump, of course, he's sitting back tweeting while you're out there and he's pushing you forward to get out there and get infected. If you do get infected, God help you that you don't. But if you do, remember that there were many people who decided to stay home, listen to what needs to be done, and wait this out. I'm frustrated too. I've been inside longer than most people in the U.S. because I chose to lock down 2 to 3 weeks before Trump made the call the word, because I was reading reports. I was reading the reports I could find from who, reports that he could get that I had to fight to get, or I was reading reports and listening to reports in other countries. And again, that's called transparency. If we all have the transparency and the knowledge of and the facts of what this disease is, then we can make our own personal choices. But unfortunately, some people think they're better than others. Just like Kumo said, you're going to go out and you're going to think, hey, I don't need to wear a mask. I'm not worried about you. Yeah, you wear the mask. but now you're maybe endangering other people, or in fact endangering yourself. And that's just not being responsible. That's not being smart. Let's be responsible and smart. Yeah, our privacy is going to be removed from us a little bit. Our freedom has definitely been removed, but don't be idiots about it. Sasha's been locked in for weeks now with no bright light of getting out. Give us some light, people. Stay home. Use your phone if you're sick. Let's get the test done that we can't get done. But I mean, the people are working on the vaccines, but the vaccine's not going to be available. So let's work on our immunity, right? Let's work on our community immunity. Try to get yourselves healthy again, and then we can enter the world and become a stronger people. Because just think about this: if we establish a good immunity, good new social habits, maybe we're not going to spread a different kind of virus. Maybe there are other viruses out there that are just as bad. And because we have these good habits now, we're not sharing them. And I have to agree with the doctor earlier this morning, when we were talking about, is a warmer environment going to cause it to go into recession? And I have to agree. I kept saying my body's hot, and that's the host for this stupid thing. My body's moist. They keep saying moisture is going to help reduce the probability, or maybe even reduce the coronavirus. I think it's going to be some kind of chemical. I hate saying it, but we talk about peroxide. If you rinse your mouth out with peroxide solutions, again, treatments, rinse your sinuses out. I think good habits, right? Washing our hands, wearing better clothing that resists, going to the shield. I mean, and I keep bringing this up, but our babies are now being born and a shield's being put over them. I mean, what do you think, Abe?
Kim, let me ask you something.
Okay.
You're just hitting the same point. If you are staying in isolation, forget about your immune system or anything else. There is nothing can hurt you if you are totally isolated from other human beings. That's done deal. You stay isolated and nothing. I mean, I'm talking about coronavirus. You can get a heart attack. You can do a million other things from which you may die. But coronavirus cannot touch you if you are isolated. It's doctors who will, in worst case scenario, they will be able to help you. The politicians, that's who will kill you at the end of the day. Not doctors, not coronavirus. So you have to protect yourself from politicians. And I'll tell you, I was listening.
Wait, time out. Say that again. We have to protect ourselves from what?
From politicians. Politicians will kill you, not doctors, not coronavirus. It's the politicians. They have all kinds of weapons. They have bombs, they have rockets, they have everything at you, and they're going to kill you. That's what you have to mind.
I think Sasha is talking about maybe another virus coming up soon, which is known as polo virus, and it's based out of politicians, and it will spread only for politicians basically around the world.
Yeah. Actually, I want to mention something. I was watching the last few days the conferences that Trump has around like 5 or 6 o'clock, and it runs sometimes for 2.5 hours or so. I've noticed very interesting things. First of all, a lot of young journalists, especially young female journalists, they are absolutely not scared to ask very uncomfortable questions. Now, the governors, they don't scare to tell him, Mr. Trump, get off your television set and do your work, do your job, and he will explain that, oh, they don't thank me. So again, Cuomo says, why would they have to thank you for the job that you have to do? Get off your television set and do your job. Now, with things developing like that, now I can see a scenario, although Trump is heavy favorite to win, second term, another 4 years, and now I have some doubts about that, because the satisfaction of not only just electorate at large, but I'm talking about the people who influence outcome, like journalists, especially young female journalists, very aggressive, asking very good questions, and he can handle these questions. Absolutely
No, if
not.
he
It's
can't
not.
handle something, he'll start insulting.
It's beyond
That's
him to handle it.
his way of dealing with things he can't answer is he'll start throwing insults. And he's not what I would consider an ideal leadership example. To me, a good leader would have immediately hired a pandemic team and put them in place in January, just as a precaution. You know,
But you see, he's very different type of president. First of all, don't forget who he is. He's an entertainer. So when it was a good time, that was a good time. So, okay, here is a stock market. Here is a show. Here is a job market. There is no inflation, no jobless claims. It's so wonderful. Oh, you want to do, what else do you want? Okay, go here, go there. You see, here's the economy. Here's the stock market. Here's everything is great. Now, when it comes to a serious thing, he is just simply not equipped with elementary skills to handle that.
no.
So if they would just send him to his estate in Florida, isolate him completely, and get somebody else, even just a little
Are
fan.
you sure we're suffering from Trumpetitis? That's a virus, right? Trump is a virus, and we're suffering from Trump. Now, I don't want Trump coming after me, which I pose no threat to him. I'm nobody. But the thing is that I agree with you, and here's where I feel sad for not just us in the U.S. but the world. It's just that if Trump continues to be our leader, his answer to anyone sinking is going to be, "Shall I send you flowers?" To me, that says, there's your death. I mean, when he twittered that to our governor, who says we still need help, we're overflown and overdriven. I don't care what kind of battling out these two do every day. They fight. The governor wasn't asking for himself or his own ego. He was asking for the humanity of people who are dying and who are suffering from this disease in their lungs. And Sasha, you shared a story with us of a woman who's a chess player, and she's been, texting on Facebook her experiences, week 1, week 2, and it's painful.
It is.
And his answer to a mass pandemic of a city who is dying by the thousands, thousands of people every day is, "Shall I send you flowers?" No. I'm sorry. We need leadership who can set their egos aside and can get in the water and swim out with somebody with a life preserver and say, "Get on, let me pull you to safety." We need a leader who can set aside his ego and say, because here's what bothers me. A few days after he says we're going to close the U.S. down, we never really officially closed the U.S. down. He starts touting this miracle drug, which happens to be something that he's invested in over in France. 5 days later, a miracle. 5 days later, and then we find out the person he assigns as the science advisor, which is a mayor from a science advisor, Giuliani. And we find out Giuliani invested $2 million in the same drug. So I'm sorry, it's all about politics. We're dying from politics here, people. This is not a COVID crisis. This is a politician ego crisis. And yeah, I'm going to get on my soapbox about it, because it's because of politicians that the U.S. looks stupid, and we have gone beyond what the rest of the world did in contaminations. And thank you, Sasha.
A funny thing is, I have a few friends who actually admire Trump, and they're saying what a great president he is, or so on. And I ask these people, okay, just give us a few examples what Trump did so miraculous and that you admire him, or so on. They tell me, well, look at the economy. We know now where the economy is. Okay, look at his foreign policy. He's a great politician and he handles foreign policy. And I asked, okay, so he met this North Korea leader, Kim Jong-un, and I remember when Trump said, we met and we fell in love. We just love each other. We send letters. It's a love. So what's happening now? Where's the love ended? So now Trump is gonna sing a song. You don't bring me flowers anymore.
Hey, we'll have to send that to Kumo. I agree.
I believe that there is a bad game going on that now who will argue with Trump in US?
Who will argue with Trump? I'm going to put Sasha up to argue with Trump. I think Sasha can put up with his insults. I think Sasha can give it back. The problem with Trump is he can dish it. He can't take it back. And
I would devastate him in 2 minutes. It's maximum what I need.
It's called a chess player strategy.
No, first I would insult him heavily and tell exactly what he is. And after that, he would run away. What else he could do?
Oh, he'll just insult back. This is what I tell people. He is synthesized from the TV show he had. And I truly believe all the decisions he's making, people are just collateral damage to him. It has nothing to do with anything other than in the TV world, after you film it, you get to edit it, nobody dies. All right. So his decisions never really killed anybody. And I think everything he's doing, he still lives in the TV world. And he just felt like, well, this will be over with real soon. We'll edit it out. My miracle drug will come out and, I'll save the day. I also think that he was afraid of his shadow in making a decision because
what's the problem? I admire Americans, yet nobody stood up to him and tell him straightforward what he really is. No single person. Everybody is trying to avoid fight with him. They're hiding. They're saying a little bit here and there. Just confront him and tell him exactly what he is.
There have been
a lot of people on internet and social media, talking about Trump and the way he carries himself and the political desires.
Everyone you saw get fired when he came into administration, they all said something to him.
Yeah.
So,
but what do you think? Trump decided that he will stay away from the elections. What do you think? Who is the right person to lead America right now? I'm not talking about Joe Biden. Generally,
me.
Who is the right
person? I'm the right one. I will make us all pray, get us all back healthy. I'll make us all do our Zumba around the world, and I'll make everybody laugh. Sasha, I think.
I'll tell you that lately I've heard a lot of journalists, governors, politicians, like senators. I'll tell you, there's 99% of the people who are 10 times more knowledgeable, experienced, speak so much on different intelligence level than the President Trump.
Well,
there are tons of people.
Right.
I'll tell you, if it would be my choice, Trump or a Mickey Mouse, my choice would be a Mickey Mouse.
Well, let me tell you why. Because Disney knew how to run. Disney was a real leader. So again, this is what I say. We need somebody who knows how to be a leader. And a good leader surrounds themselves with good people to do the work. Trump can't do it. He doesn't know how to do that. He just knows how to
fire people.
Right. He just knows how to fire and fire. You didn't do what I want. But you put in place the right people with the right skill sets to handle the right situation. If it were me, I would put David M. Walker head of our financial economic situation, or maybe George Lemire. There are many people out there who could do that, but I probably David, because of his strong ethical background and what he had done for our country with 4 other presidents. Now you have to remember when you work in a job where a new president comes in and you survive several presidents, you're pretty dang good, right? What does that say? That says it didn't matter what their opinion was because they were all either Democrat or Republican, right? He saw shifts in the parties, but they still respected him, right? It didn't matter what party he was. They still respected him, even if they didn't approve of his opinion. And that's a good leader, okay? A good.
And that is what the experience is all about. That is what the experience is all about. When you have done so much of work under different ministries or under different presidents, you know what to do and how to do and with whom to do. And you also need the right person for the right job. That's what happened in India as well. There are a lot of bureaucrats who joined the politics and they are doing perfectly good job. And also a prime minister, he was the chief minister of a state for 15 years and then he gradually, become the president, the prime minister of India. So he knows how to carry the things and how to manage it out and how to run the country. I think Harish would agree to me that how things are moving in India in a much streamlined way, and also we all might be from different parties, but we are united and trying to sustain the best possible manner to help our humanity in India and around the world to save away from coronavirus. And I think Harish would be also doing a lot of good research in corona. Harish, do you have to say something on this?
Yeah. See, coming to the right now, major crisis is there in US, isn't it?
Yes.
So here, whether president is taking a concern or what way he is addressing is secondary. What experts from the industry or from the country has to unite together and give a positive support or a solution. There are lot of methodologies are available. It doesn't mean that corona cannot be controlled. We can control it. The very biggest mistake done in US is the lockdown was delayed too much. If it was lockdown was implemented immediately, the things may be under control. So what happened in India is lockdown was implemented when there are few cases were identified. It was all over India. It was less than 100 at the time lockdown was imposed in India. So today we have not crossed even 15,000 positive cases in India. Here, what is the thing is that our Prime Minister, he takes the expert suggestions. He discusses with the experts. And the right time, right decision is very much important and required. So I think expert team should go ahead and give some positive suggestions, and the strict lockdown has to be implemented. I don't think so in US there is a strict lockdown is implemented also.
No, there's not. But the thing is we lack the leadership to make. We lack not just the leadership, we lack the humility and the wisdom and the knowledge to do something like that. We're not humble like your country. We're a bunch of people who are spoiled rotten. Everything, we rely on everything being immediate. We want immediate answers. We want a pill to fix our problems, and we want to just get back to our lives. So we haven't learned the humility. And I agree with you. We still haven't locked down. There are still places that are still functioning and operating. And they're suffering now. Like that's the reason why Smithfield Farms, which is one of our largest pork industries, closed down. They literally, all of them had to close down. But what a lot of people did not know about Smithfield is actually China bought them many years ago because China killed their farms with a virus. So in my mind, I'm like, all we're doing is giving China an opportunity to kill our farms with a virus and maybe kill us. But nobody looked at that. Everybody's like, oh, you're being stupid, Kim. And I wish Rakesh was here so he can say, calm down, Kim. But the thing is that we have seen this happen time and again in history. When I'm reading about the first case that was ever diagnosed with corona back in 1964, and how it was found to be, in chickens too, right? So we already knew it was in chickens, and we already knew that it actually can be in the liver enzymes. Why the liver? Because as your body's flushing out any impurities, your liver, if it's in good shape, is going to divide the bad from the good. That's what it's supposed to do. and it's going to flush out all the bad and put all the good back into your body. Hopefully that's what happens. But they found, they've known about it. But you're right, it's our leadership. We not only didn't lock down when the rest of the world did, we delayed it as we locked it down. We dragged our feet like spoiled kids. Oh, Mom, do I really have to go to bed now? Delay. And even in my own state, I watched my governor say, okay, we're not going to have sporting events. We're not going to have this event. And in that same week that he shut all the events down, he lets us hold, 10,000 people concert. All right. So, and in concert, we're crammed like this. At least at a sporting event, we're separated a little bit, but they're crammed like this at a concert, right? And there was somebody there infected. And I'm like, what idiot allowed a concert? Well, that was a leader that allowed a concert. And what I'm learning through this virus is who the real leaders are. That's what I'm learning.
I think who are the real warriors are basically, because the leaders might be doing the job, but there are people who are outside and fighting with the virus in front line day in, day out. These are the warriors for us. I mean, I'm not talking about doctors only, but there are a lot of frontline staff and research people who are doing a lot of, tremendous job. In fact, the general public doesn't know how they're dealing with it. I think Harish would share more stories, because I was keen to know that if you are doing some kind of research with a COVID patient, you have to do a lot of, PPE things. So according to a general person, you are trying to put your hand inside a dead body and trying to figure out what's going on.
Yeah.
And that might cause you as well. So what are the ways or what are the processes and theories behind your research, and how do you do it?
Right. What are your thoughts on that? What are your thoughts? That's a good question.
The personal safety is the first priority.
Okay.
And personal safety and personal hygienic is very much taken into the concerns. But there are some issues also are there. For that, even patient has to be cooperated. And nothing other than personal hygienic can prevent the doctors. Personal hygienic and protection against the disease, precautionary sanitizer.
But I think you have to also motivate your employees and people who works with you that we are following this. Research, and we have to follow this thing, because there's a psychological and mental.
Yes, you are right. You are right. People does not come forward now. Actually, people are they are not coming forward to work.
Yeah.
Many people, they say, is it the time to work? Our life under risk. Why we want to put ourselves into the risk? We can hold the activities when this epidemic is going on. Why we should do this kind of activities? Let us hold for a few days. Those are all the things is there, and many employees may not come openly to work forward. We have to motivate them, give them the personal hygienic and safety measures has to be taken care into the entire facility. In every stage, the personal hygienic and safety parameters has to be considered. Without safety parameters, it is very difficult to handle.
And are they demanding some extra benefits like insurance, or maybe something extra, maybe double salary or whatever it is, to protect themselves or maybe their family?
Yes, insurance and travel allowances, safety measures, everywhere sanitizers and all sort of requirement. What is required for their personal hygienic has to be implemented in the workplace. Otherwise, you may be knowing that in one hospital in Mumbai, Wakad Hospital, I hope you are aware of.
Yeah.
So totally 130 nurses and 3 doctors got infected, and that hospital is totally locked down today. It is a deserted.
It happened with one of the hospitals in Delhi as well, that some of the nurses and doctors, found out with symptoms, and then they have to close the hospital. That happened in Delhi as well. But also, that, a lot of doctors are also in a bad shape due to unavoidable circumstances by our, people.
See, now what is the major situation is going on? Now, Corona is the major situation is going on. When any patient comes, what happened in Wakad is that the patient come with a heart issues. So they just taken him inside without addressing any precautionary measure about the corona. But that was a corona patient. Who all are the doctors and nurses interacted with that particular patient, everyone got infected. Now doctor has to be done. Let any disease, any person with any diseases, let them come to the hospital or to the any facilities. Their first point has to identify whether he is a corona positive is there or not, or any symptoms of corona is there or not. After that only they can address the things, and the corona safety precautions has to be taken care. Even though doesn't have any symptoms, but they need to address that issue. So without that, it will be means the major the medical facility will be get affected. I think in India already 2 doctors died.
Yeah.
2 doctors died.
Yeah. But do you think that, I mean, India is on a right track in terms of maintaining the spread, and I mean, the way our government and state governments are working together, and also in terms of the innovations in as what my lab and Mahindra have done, they have created a lot of I mean, instruments or technology in this pandemic.
Ventilators. Mahindra and Mahindra came up with a low-cost ventilator, thinking that there may be, because India is second highest populated country in the world. So if it is infected and it is uncontrolled, it will be a disaster here. But now India is under control. So we have just crossed 15,000 positive cases and few hundreds of even 100 plus deaths only.
Yeah.
And I feel Indian Prime Minister is controlling the situation very fantastically, and he is having video conferencing with every state CMs and looking into the state affairs. What is the, how many positive cases are coming? What is the scenario? How many people are getting discharged? How many died? On a day-to-day basis is taking, and entire situation is controlled. The authority is given to the CMs, and the CM in turn, the DCs of the district collectors have been there, and overall issue in India is controlled by our Prime Minister, and he is very successfully and fantastically done in a India-like country. After these many of days of outbreak of corona, we have still only 15,000 positive cases.
Wow. You know, you know, and if you look at the overall cases in the world, and then you look at the US, it's just mind-boggling. I'm just mind-boggled. You know, we're still flying people around in the US. I don't know about your country.
Yeah.
India is totally locked down. No flights operation.
No, we
can't even send a letter to Harish. So I can't even send a letter to Harish right now. So that's what the what's happening in India.
Our flights still look like anthills. We're 50% in flight. I know the head of our traffic in the U.S., the director, and he he told me that they're going to maintain 50% of the flights. But the thing is I don't know that the planes are full. I know people have flown. I don't know why. I wouldn't get on a plane. Everybody goes, "Oh, it's cleanest it's ever been." And what I want now is I want somebody to track how many COVID cases have been transferred on planes recently. But what people don't know that I found out, and this is why I'm not getting on a plane right now, is that the air traffic controllers have become infected. So what if the air traffic
and Kim, you know that, I mean, it started with a flight only because people started flying from Wuhan to the world, and that's how it started spreading. So, I mean, flight was the first mode of transport, how the spread happened to different countries. But still, I mean, I don't know why, because in India there's a lot of flights going on, but in India, a lot of drones are there to monitor the progress reports of the lockdown and monitor the places around India. And also doing a lot of sanitization supplies and other medications. So I don't have the numbers, but there are thousands of drone monitoring our population and our people on 24/7.
Yeah, I mean, I agree. I think the flights, any kind of transportation system is where we're transmitting any kind of disease at a rapid pace. again, I hate to say this. I think that if we're going to get back to any kind of social norm, we are going to have to microchip ourselves. I know this is something that Dr. Yu is totally against,
Yeah.
but I think that as we move forward in life, we are engaged with evils that we need to learn to live with. I think building our immunity system is going to be imperative. I think the way to do that is a checkpoint for immunity. And I think it's going to have to be in our blood. And I think the easiest way to do that, so we don't have to prick ourselves every day, is to have a chip implanted. Also, that way, if we have to live in an environment where we are more more confident, I'm not going to say more comfortable, but more confident in going out with a mask and eyes and shield, you're not going to be able to recognize the person. And so I think a microchip is going to be able to identify the people. Yes, that's going to put us into that movie Minority Report, or even worse, The Matrix. But I'm going to be upfront with people. I've
But
worked
how
in
about virtual reality? I mean, a person virtually manages your job outside, and you are managing that person from home.
I mean, I don't think it's managing as much as it collects data and just generates a report. I don't think it needs to come back and say, oh, she went to the bathroom, she's over here or not here. I don't think we need to be tracing where anyone is or where they've been unless something happened. So say that somebody got contaminated and brought to the hospital with COVID-25. And there's chips in everyone now, not just our cell phones, because we can do the cell phone right now because nobody leaves home without them. But now what you do is you utilize AI. AI is going to go out and it's going to scan backwards, just like my tool does, right? It's going to scan backwards and trace where that person has been. And it's going to compare the people in that vicinity, right? And it's not going to sit there and go, oh, you did this or you did that. It's just going to generate alerts. Hey, you were close to somebody who was contagious within the last 14 days. Please get tested, or please be careful. It's not going to take your rights away. It's going to protect you. But I'm going to tell people something up front about telecom and datacom. I've been in that industry for since 1984 when I first became an engineer. And we've never had privacy. They have been able to listen to every conversation you've ever had. And the more digital we became, the better that became. Not only that, they have special storage devices that do nothing but can collect our data and store it forever. So, I'm just telling you, you've never had privacy. You never will have privacy. The only time they use it is when they want to. Trust me on this. The only time they will pull that data out. But I have actually, back in 2012, was at a conference back when they still had the ComNet, which was a big telephone conference. And they said, Kim, come back here. Because I used to work in the diagnostic side of the world. And you got to see this. And I go, what? And they were capturing every cell phone message in the conference. Every cell phone message, we were reading them. Every text message, we could see what telephone number it came from, what the message said, everything. Personally, I don't care what people text each other. I knew that could be done because if it crosses over the networks are regulated by federal government. No matter what government it is, they own it. And so they own every data that crosses over and into the network. That it's all owned by the government anyway. So get over the privacy, get over that fear of somebody seeing you, and behave as if somebody's watching you all the time, right? Stop sexting. Stop texting stupid, goofy stuff. Or, if you just don't care. But get over the privacy. Get over yourselves and start working with each other. I wish the politicians would. I think we are suffering from politics. We're going to die of politics in the U.S. India's got it. You guys have figured this out. Canada, you guys are so relaxed. Sasha, be expecting me to cross the border when it's safe.
As a matter of fact, a lot of Americans are now thinking of moving to Canada. It's at least it's close to US. It's a little bit
Yeah.
colder than US, mind you. There is a trade-off. However, the medicine is, I think it's better organized. I'm not saying that Canadian medicine is better than US. I don't think so. But from economical point of view, from social point of view, it has a lot of merits. At least, yesterday, somebody was telling that people get $76,000 medical bill to pay after the operation. I think that's very difficult to stomach for Canadians. I could never even imagine that it's possible. It's horrible.
And, you know,
Asha, if I ask you about Canada, I mean, apart from Canadians, what are the major, population living in Canada from different countries? A major religion in Canada.
Uh, you see, Canada has a different immigration policy from US because, first of all, Canada. Okay, the point is that to develop further, Canada needs immigration. It cannot organically develop because the birth rate is not that great. Country, at least until recently, quite well developing, and there is a need in human resources, especially qualified human resources. But if they're, even if they're not so qualified, maybe their children will become qualified, their children. So we need to expand our human resources. This is number one policy, and nobody can really fight it. That's a fact of life. I think until recently, US had probably the same policy. Maybe implementation was somewhat different, but the reason for immigration to increase the human resources, it was always there. I don't know how US will continue to develop without extending their human resources. So that's why US needs immigration. Of course, the methods could be discussed, but the overall policy, I think, nobody will be able to prove otherwise. So, in Canada, there are not a lot of really discussions about that. There are some more radical people that say believe that we should trim our immigration, and some other people want to increase it. But that's where we are, and we have very diverse population from Southeast Asia to Latin America to Eastern Europe to just name it. I mean, it's very diverse community, as a matter of fact. I hope I answered your question.
yes, you did.
Yeah.
Yes, you did. Go ahead.
Yeah, what I feel is now the world need to think whether economy is important or humanity is important. I hope most of the countries are worried about their economy. So that's why the proper shutdown is not implemented. Even some commercial activity still happening. So what we have to look is whether life is important or economy is important. Every day we need to think about this. And international borders need to be closed. None of the country people from one country to another country has to be moved at least for next 3 to 4 months. The flight operation should not be there, and everyone, even individual or a company or a government or a president or a prime minister of the country, first they have to give a priority. What is their priority? Priority is economy or humanity. So most of the places they are thinking economy. What happened in China? They think about the economy and reopened.
Yeah.
No,
The
I
same
agree.
We have to decide between our economic life and between our human life. And I think humanity, if we have humanity, we can rebuild the economy. We can rebuild the economy as we have done it in the past as well. So if someone will get a chance to redo the work they have done, I think it would be easy for them to do it. And if we humans will be alive, we can recreate a lot of new things.
Yes.
And I think there's a reboot time where the environment is rebooting on its own. And we have seen, you must be aware about, Harish, what's going on in India about the environment. So it's an auto reboot mood, and it should be like the way happening in Canada or US or maybe some other countries. because environment knows how to reboot. World knows how
Yeah.
to reboot environment and world and whatever we call about the global warming and all those things. And we in fact got a news that ozone layer is also automatically repaired, and it's much more better shape as it was in the past. And I think we have
Pollution
more
is
thousands
100% under
of
control.
yeah.
So I got a
So
question for all of these international smart brains here. In looking at U.S. and what the way we behaved, would you want to come here and visit us now?
No.
Thank you.
Um, it's very difficult question. I
yeah,
love US. I'll tell you, it's so diverse. You can probably travel. I could travel probably for a year and a half, visiting every state. Sometimes I'm looking even the best hotels in every state and restaurants and casinos and places which I would visit. Sure, it's not possible now, but hopefully it will be in the near future. And but to live in US, it's a different proposition. I don't think that I would like to live in to make it a permanent home. I don't think I would do it.
You know, it's definitely reversed its role in the world, and
yeah.
it's definitely reversed its appeal. I can only say that this has probably only happened in the last 4 to 5 years. Um, because I don't think people felt that way 4 or 5 years ago. I think many people we found us appealing. Even when Obama was a president, we were still appealing to the rest of the world. Yeah, and you kind of not answered that. What are your? I want to know.
So
What you think.
I agree with Sasha that I mean it's difficult to forget US, and we have a lot of close relations with America, not in terms of business but also in terms of family, because a lot of friends and family live in US. But as Sasha said that we certainly will visit US. I mean in future whenever it's possible, but it's not a good. I mean. It's not a good option to, I mean, shift or maybe start residing in America at this point of time. But maybe I think down the line, once you have a new government lined up, and I think things will change because new people come with new innovations and new way of life. And also in the current pandemic, everyone is tense and everyone is scared, and they are not sure what to do because they have done some mistakes initially, and then they are trying to dig out those. Problems and filling up those mistakes with their, I mean, so-called plan A, plan B, plan C, plan D. Because what happened in India, I mean, the day started, I think we were talking about the lockdown, and the Prime Minister of our country, he's very bold and he's very courageous. So he took the decision, so we have to do a lockdown at any point of time. At that point, if I remember, we had more than less than 100 cases, less
Wow.
than 100 cases in India. At that time, he decided, let's go for a lockdown. And during the lockdown, those 100 become 15,000. But still, I
Uh,
mean, you need to understand that we are concerned about the economy. We are opening our economy tomorrow for some essential workers. I think Harish must be aware about it. But in totality, the places which are hotspot, I think those places will not be
Still
normal
not
for
open.
the next 2 3 months. And that is what I mean, concerned about US. That I mean, we wanted US to take some actions because I mean, you won't believe that I have spoke to a lot of people from different countries. Everyone is asking me the same question: What's happening in America? Why are they not following the rules? Why are they not learning from the past? And why are they not learning from Europe, Italy, Spain? And why are they so much concerned about their famous White House and the famous dollar note?
And you know, again, I wish we would take people's lives over our profit, right? Humanity over economy, and we haven't. We're still got people so angry over the economy right now, and this whole protest thing that's happening is really disturbing me because the more you have people that protest like this, the angrier our country gets, and the pitchforks start coming out. And it gets you have no idea. It gets really angry and really bad around here. when the protests start, because we don't contain it. And then when you've got a president instigating it and promoting the protest, I'm a little at odds at how grown up is he? You know, what a child. He should be leading us to pull together, not protest against each other. And that's not how he won to be a president. He won to be a president by pitting people against each other and by dividing people. And
I think he wants to make everyone scared, and everyone. It seems like he wants everyone to believe that he's in total control. Because what happened with with the hydrochlorine supply from India to America, we got a news that Trump was scaring us, and he said that if India will not supply the drugs and all those things, so we will take some hard actions and all those things. But Kim, you won't believe that deal happened a day before, and everything happened in smooth way. But when he joins or when he comes out of the media, discussing about what's happening and what he's trying to do, he is dictating himself that he is the one who is taking all these decisions.
And you know, I have to.
And he's scaring people to take those calls. If no one will agree, then he will take.
No, and I agree, and I have to wonder all the people who came forward and said, "Thanks to Trump, I lived because I got the hydroxyline," and I'm like, Trump didn't bring the hydroxyline to you. They didn't. He's not the one who kept you alive at your bedside. That was that nurse and that doctor. But they all came out and said, thanks to Trump. And I got to wonder, when they signed the disclaimer to get the hydroxyline, did it say, I'm going to promote Trump for giving this to me? Because every one of them that got the hydroxyline all came out and said, thanks to Trump. And I'm like, not one of them said, thanks to my doctor. Not one of them said, thanks to my nurse or my spouse or my, child that got me to the hospital. They all said thanks to Trump, and I go, what a pandering of all of this. And that, yeah, go ahead.
I remember 3 events since the day we are doing this special show on COVID, since March 13th. First is when we started, I think in US there are around less than 500 cases, and now you are about 700,000.
6,000.
Yeah. Secondly, I know about stimulus is coming up, and we were discussing about the stimulus and all those things. But there is, I was reading an article at some foreign media website that if things will go the way it's going in America, they might be having 2 million people suffering from the COVID-19 because they're not stopping the flights. So will there be again one more stimulus of $2 trillion what Trump is trying to sign in? And the third point is, you got a letter from Trump, you got a postcard of what to do and what not to do. I believe that, and we have discussed about that, with that postcard, you should receive that N95 mask for a family from government of America. Because if you get it, then we believe that he's doing something right. But by sending that postcard, that means he's offering you to vote for him. That's what we realized sitting in India.
Yeah, it was, and I agree with you. He should have sent a package of masks and gloves. Heck, order them on the dollar store. We're here in the United States, and the dollar store is still delivering within 3 days. The Amazon is not. No, I agree with you. And folks, to stay home and order your essentials from the dollar store, it's a lot safer, it's a lot cheaper, and they donate back to us. But again, he is, everything he's doing is about promoting himself. And we saw this in the campaign. I made a bet with someone. I said, I bet you from the moment he started campaigning, you will see him 5 times in the newspaper, in every newspaper. You will see him 5 times because he knows how to market. That's how you market. And he knows how to run his mouth. And he learned bad advertising is better than no advertising because his face is in the paper. So literally, for all of that campaign, he was in the newspaper 5 times a day. He was five times. His face was shown, and I'm like, so the newspaper promoted him more than anyone. Our country is backwards when it comes to a democracy for elections. If you see how our primaries are ran, unless you are very, very wealthy, you will not survive the primary span. Also, by the time the primaries get to my state, all the good people are gone because they couldn't survive because of financially, or they just weren't voted in. I don't like why can't we have the primaries in one day? It's affordable. I get to elect the person I want. I always often wonder, will our primaries end up different? So I think everything is fixed so that they can control and manipulate who is running and who's campaigning. And again, I'm shocked Bloomberg didn't make it. Majority of the people seem to especially the business people, seem to really support Bloomberg. So I think the
But
whole
I think Bloomberg would be regretting his decisions because it happened pre-COVID, and after COVID, the strategies and the situations and the dynamics have changed. So I believe that Bloomberg would be regretting his decisions of, taking his name out of the elections. What do you think, Kim?
Kim,
Or
if you studied really the election of 2016, let me tell you a few things. Number one, Trump was a compromised candidate, which there were 17 people, one of them was Trump, and he was number 17. The 16 Republican contenders, they all hate him, and it went as far that Republican Party actually hired services of a company by the name, it's an outfit, by the name Fusion GPS. They hired Fusion GPS to come up with all kind of compromise on Trump. Everything what he's done before, all his story, everything what he was doing in his life. And while they were working on that, he was making very well in the pool simply because he was giving television stations good ratings. And a lot of stations, including CNN and others, they were all in line for interviews with him and all kind of broadcast about him. And by the time the Fusion GPS already had very, very substantial material against Trump, it was too late. And by April 2016, Republican resigned to the idea that, well, it seems to me that people really like him. And you know what? We are risking to give power to Democrats if they will win this election. For the next 75 years, Democrats will be in the power. We will never get power away from Democrats. So the Trump was sort of like a compromise figure that he has a good chances to win general election, which they still didn't believe that it's possible, but at least he would have a shot. So they started to work for him, support him, and market him any way they wanted. At first, they were all his enemies.
so
Now,
yeah.
sorry. Yeah. Okay. So by the time, but they already Fusion GPS already had a wealth of information against Trump. So they called, they sent email, I think, to Democratic headquarters with just one word: Trump. And answer was in 30 seconds. We are going to call you. Okay, so then they started to work for Democrats, and they were, of course, found all this information about Russian connection, about his bankruptcies, about the money that he used to get back in the power, because no American bank would finance him after all these bankruptcies and so on. But that's all history. It's neither here nor there, because today we live in 2020, and different forces are in play. And well, I think American people are not stupid, and they will definitely make their choice. If there will be a choice, I still don't rule out a situation when there will be no election in 2020.
So the reason why Trump won the last election, and I hate to say this about America, but we are the most anti-female woman leadership country in the world. And I
Not
guess
only that, yes, it was that, but I think that the major part was the Russian influence of 6 states, which eventually gave Trump victory. And Russians were smart enough to operate only in these 6 states, nowhere else, and they were extremely successful.
There
and
was one more strategy what Trump followed. I mean, because a lot of Indian volunteers were working for Trump, and what that strategy was that they are trying to see what kind of speeches or what kind of keywords or what kind of news or what kind of announcement Trump will make, or people would like to listen from the Trump. So, based on that survey, Trump was only speaking to those lines or those content or those keywords what the public wants to listen. And in out of that, the first and the topmost campaign was America First. That is something what all the people would like to listen. What do you mean by America First? And that is what. So there's a case study which happened, and a guy from IIT Delhi, he was the part of that volunteering team, and they have did it using the artificial intelligence and breaking down those keywords. I think Kim would agree that that's happened. I mean, that's why
Agree.
after that we have started spying on what's happening in Russia and how the influences started up from Russia and China and all those countries.
Another thing, I just wanted to add one more thing when we were talking about international politics. Um, Trump spends hundreds of billions of dollars on military expenses to get more arms and so on. But what the most important thing in the world, because unless you start the war with somebody, all this just a waste of time and money. What is very important is so-called soft power. And in Trump years, America lost trillions and tens of trillions of dollars of soft power in the world. What is a soft power? It's influence of America through culture like Hollywood, sports events and sport teams, and many other. It's a perception of what America stands in the world. It's friendly, it's helpful to other countries, and so on. All that has been destroyed in the last 3, 4 years. It's no longer there. America is perceived as very selfish, aggressive, unreliable partner, and that's why there it will be a shift once coronavirus will start going on the background. Hopefully soon, there will be a very big shift in international politics, alliances, and the way the business will be conducted.
I agree with you on that. I would like to understand the world's view on when Trump fired who. And also, because we know now that we're going to have to join together as a world, right? We're going to have to become one community, not just in business, but just for our mental and physical safety, our health is going to rely on us working together. We're all very upset because China did not, they were not transparent when they became very, very sick. I think they kept trying to cover things up. We all understand sometimes that that's just going to happen. That people are going to cover up in the beginning because they don't want to get sued or they don't want to be held blamed for something as big and horrifying as this became. But we're going to have to. We're going to have to change our ways. We're going to have to become very transparent in how we communicate with each other. But when the president blamed the WHO, I got to know from the rest of you guys, especially the doctor and medical side of the world and other parts of the world, the WHO was very transparent to everyone, right? They didn't just say, okay, India, here's your data. Okay, China, here's your data. Okay, Hong Kong, here's your data. And then everybody kind of do their own thing. The WHO shared the same data with everyone. How is it you guys knew to shut down earlier and take those precautions and we didn't? What
I
do
think
you?
it's about political willpower. That's it. That makes a difference basically, and also politicians who understand their country and their demographics and their economy and the people, they can, and they are also courageous enough to take those bold decisions. They have taken it and they have done it That's what happening in around the world. And if you just see the pattern, what happened in China, China knows how to control it, or whatever conspiracy theories we are coming. I mean, we are listening from China. We are still not sure what's happening in China, but China knows how to control the population and to the people and to the economy and all those things. Now, I think what we are hearing that China is back on track with the economy. There are some cases of disinfection which we have been reported in couple of in past 2 or 3 days. But rest, as the country and the government says, everything is in control. And when you go to countries like Italy, Spain, France, and all those things, so they were just relaxed and they were watching what's happening. You know what happened in Italy in starting of, I think, first or second week of May. There was a campaign because Italians have started boycotting Chinese people. So there was a campaign that hug a Chinese guy because they are a part of our society. So they've started hugging those Chinese guys who were wearing the mask and who were slightly away from the community. And while doing this campaign, it spread across Italy because they were talking about humanity, that we are boycotting the Chinese people from Italy, and we should not do that, and this virus won't kill us if we hug and all those things. And that campaign got a disaster, what you can say, impact, and that's how it spread in Italy. And same happened with Spain and France and all those things. So they were thinking that they are superpowers or they have a lot of militaries and there are a lot of equipments and all those things, but nothing is working as of now. Italy is the second country with the best healthcare in the world, and they are in a very bad shape, and they don't know how to control it. I think, they have lost a lot of doctors as well. So as happened in France and Germany and all those things. And France, people who have been COVID-19 positive, they are crime progress. So what happened with France? So they are taking German government help to treat their patients. So a lot of people patients in France, they are transporting to Germany for the treatment because Germany is having one of the best mortality rates in terms of managing the COVID-19. And when you talk about countries like you can say developing countries like India and all those countries. So we know our strengths and we know our weaknesses and we know how to. If something would happen in India, it would be a difficult situation for anyone. I mean, Harish would agree, to manage the things and to manage the spread, because we have different lifestyles and we are 1 billion population living in a density of area where people living, thousands of people living within a span of 100 meters. But so that's why government take a lot of courageous steps and follow the guidelines, and also learning from what's happening in China, what's happening in Italy, and what's happening in Spain. And that's how we took it. But I'm still surprised what's happened in countries like America and maybe South America as well. South America started a little late, but they are still in control because there are very less commuters from those countries traveling to South America, and so is Africa. But majority of the strong nations, they think that they have money and they will be able to manage it out and they know how to deal with it, and or maybe they are okay with this number of deaths. That's what I was listening, that someone is saying that okay, if 100,000 people will die, okay, that's fine. We'll manage that. But in India, our rule is that if one person will die, we have to close it down. So tomorrow the economy is opening up for some people, some essential workers, and all those things. But the disclaimer is that if there is some reported cases in those areas, we have to do a strict lockdown again, and that is what we are following here in India.
Wow. It's again, it's about humanity.
Yeah.
And I think that's the kind of leadership we're going to need. I also think that in the future, we're going to have some sort of world leadership, like we read about in science fiction books.
Yeah.
I think that there needs to become a world collaboration to make the leaders get intact. I think, that we can each operate as different cultures, but we have proven how a virus, again, I go back to science fiction a lot because this is the only time you ever heard about these kind of things, right? And maybe they were written for a reason, right? Maybe it's not our Bible or our religion, but maybe we should look at some of these and go, wow, what were these guys really thinking? Because a lot of this is happening, but our battle isn't of humanity right now. It's not against humans. Our battle is against nature. It's against a virus. And you know what? I'm going to tell you guys. My mind sometimes goes out there in the science fiction world. Nothing's saying we didn't bring this back from Mars when we came back from the moon and splashed down back in 1964. I mean, think about this. Back when we were coming back from the moon and we splashed down in the ocean, right? Maybe we brought something back with us in that time frame, and then it started to infect us. So, I've seen way too many science fiction movies, but we got to think about that. Maybe this was something we did bring back from somewhere else. We just
there is a theory actually that some, for example, chess and backgammon and few other games were originated in a space in another planet. Human beings could never ever come up with such smart, brilliant games. It was impossible, especially that it happens 2,000 years ago. How 2,000 years ago, in the times of Julius Caesar, it was, or even Alexander the Great, it was actually more than 2,000 years ago. How people were so primitive, how they could come up with games like chess and backgammon? Impossible. I don't believe it. So it came from another planet, from another civilization.
I'll take one more story. So, Kim, what happened in our mythological stories? There's a god which is known as God Ganesha. Okay, and that god Ganesha was playing with something, at some point of time, and while playing it, he came across one of the other god, and they started arguing on some topic, and then Ganesha said that he is the son of Lord Shiva, who is the ultimate god in our mythology. He's the goddess of god. So, but the person who was arguing with, Lord Ganesha, he was not sure what he's saying. So he removed his neck. Okay, and then without the neck, Ganesha, was crying, and he, reached out to his father, and he said, "This happened to me," and Lord Shiva was angry, so was his mother, and all those things. So what they've done is, after a lot of understanding what's happening and what happened and all those things, they have, give them an elephant's neck at that era. So that means, so what we believe in India, or maybe followers of Hindu, that if a transplantation happening right now, that is happening in the past as well, and we have transplanted someone's neck on some other body, and that's how you see Lord Ganesha. If I'll share a picture, the face is an elephant face, and then there's the body.
Got it.
That's how. And also, when you talk about the face time and all those things in our mythology, there are a lot of people who have this power where they can see for thousands of miles, or maybe in a different country, what's happening through their vision, and they dictate, or maybe they address that vision to their king, or to their dictators, that this is what happening in America, this is what happening in this country, this is what happening in this region. So I think we are, as Sasha said, that we are taking all those things back to our, lifestyle in different ways or different innovations, because that was there in the past, and that is what there in the present as well. And I'll say, and also with, Harish is into research and all those things. So the research is also part of that old therapy that we used to have a lot of therapies in the past, and now we are just changing the mode, or utilizing new technologies, or maybe new ways to do that research. Harish, what do you think about it?
Yeah, you are perfectly right. You are going on a right track. So transplantation, it is not a new technology to India.
Yeah.
Okay, that's
Kim,
and what about the
something
interesting? One of the best example Ankit has been given.
That's
Kim, something interesting to add what you were talking before about females in politics. Here is something from, I'll just read from New Yorker, the New Yorker magazine. Last week, a flurry of wildly shared articles noted that a number of countries deemed to be doing well in the fight against a novel coronavirus have something in common. They are all led by women. Whether this observation is meaningful is hard to say. The countries in question are disproportionately small, wealthy, Scandinavian, and not incidentally providers of universal health care. But the idea had social media appeal. Could female leaders be, as Guardian put it, the world's secret weapon? How about that?
So yeah, and I mean, so many countries respect their women. They think women in America are respected, and I get kind of a lot of text about the fact that we are not. No, I just and I will tell you guys this: if you look back in our past political campaigns, anyone who ran a female or where a female ran lost by a landslide. But it's because the women don't even support the women who are going into power in this country. They'll find a reason to hate them, like Hillary. My favorite excuse that women have in this country to hate Hillary was because she called that woman that Bill had an affair with a hoe. And I'm like, okay, what would you have called her? You know, if you caught your husband with another woman, what would you have said? I mean, it just, and she didn't say it in public. She didn't. She said it in private, and somebody videotaped it. So I'm just saying that we have a very closed mindset. I think there are very great women who would make great leaders because I think women think different than men. We some. I mean, you get those women who are all about the money and all about the business, but we give birth, okay, for the most part, and that's just part of nature. You become this figure of wanting to protect what you gave birth to, and I think that women think that way. Also, women make great housewives, and housewives, many of them learn how to budget, right? Some of them get no money to budget with, and they make miracles happen in the home. Like all of a sudden food's on the table and clothes are available. My mom did great job manufacturing our clothes for us at home. So women have great capabilities and science minds, but many times I have researched in past where women were the reason why science and technology grew, but they were never given credit because they didn't have the college degree, or they were just women. So other countries tend to respect women differently than we do. So I'm not going to put us down. I think we've made some progress until 4 years ago. Then I think we went back 100 years. I think our leadership has a lot to do with how women are treated. But I agree with you. I've read that same report that the countries that have leadership, women leadership, are faring a whole lot better than anyone else.
I think the best example is right now is Germany, because the chancellor is, managing the country from past so many years, and also right now I'm not sure, but I think the prime minister of New Zealand is also a woman, and but I believe that less than 1% of the women is managing the world right now.
Yeah.
Because only few of them are running their country or managing their country. Apart from that, it's all male-dominated society, and we don't want women to manage it out. In India, we say that our home minister is a woman because they manages the home, and home means they're managing 4 or 5 people within the home and managing the budgets and managing all those things. So, we believe in India. And I think Harish would agree that a lot of savings happen from home in India.
Yes.
I
They are called as home ministers.
I think there needs to be a harmony between both men and women, just like I think there needs to be a harmony between all of our cultures. When I listen to our different culture stories, I hear similarities, right? And but more than anything, in every one of our religions, we all have the same ethics, right? We all have those same ethical rules, and that's respecting each other, respect your God, respect your earth. And I think there's that's the reason we can pull together and be together. And we just need to. We need to, and we need to stop the flights. I agree with you, Dr. Rush. We need to stop the flights. We need to ground ourselves and get it.
You need to stop your subways. You need to stop your transportation as well. That's what we are doing, and that is why we are still, safe for society in terms of if we compare to the world. You won't believe there is no transportation, no metro trains, no nothing is going on right now, apart from the essential people who wants to travel. That's it.
If you maybe if we looked at the graph that as corona went up, our economics went down. Maybe if we look at the world map, the GIS map, where all the planes are, that's where all the coronavirus is. And I even said that the last time we saw that. You see all the flights flying right here, that's where all the coronavirus is. And it looked just like coronavirus growing because they were just moving. And you look at the rest of the world, and there was no other flights going on except for maybe air cargo, right? Personally, I wouldn't want to get on a plane unless it was private. And everyone says we're going to close. This is what I heard. We're going to close the private airlines down before we close the commercial airlines down. And I go, that made no sense whatsoever. Who made that government decision? And he goes, what? I go, who made that political government decision to close the private airports down before? I said, a private plane is clean. You've got fewer people on it, seating, several feet apart usually, unless you're in the small private jets that, are just for a few, 12 people to go. Like I call them jet buses, right? And but I'm like, who made that decision? That's stupid. And then I got to remember to shut my mouth because it may have been them, but but they started
Do
thinking.
you think, Kim? Do you think the future transport would be those? Two-seater drones flying from one place to the other? Because the models are right now available. It's still in the trial, and there are government permissions pending because of the, the air traffic management. But I believe that due to this pandemic, those two-seater or four-seater drone transports will be soon available, maybe through Uber or maybe some other companies. Tesla is also coming up with something. I'm not sure, but Uber I think has started working on releasing those commercial for users. What do you think?
So I think that originally they wanted to go to everybody get into the electric car like the iRobot movie, right? And pretty much it's all autonomous driving. Nobody owns a car anymore. But I don't think you can trust that anymore because you don't own it. You're not going to keep it clean. So I think I don't know. I think first we just need to get past this and understand what we're living with and learn to live with it and learn how we're going to live with it. Then we'll go to that. The transportation was going to where they had air flying cars. I was kind of scared of that. Heck, people can't drive in rain around here. I can't imagine what air flying cars would be like. I always go to the movie Fifth Element when I see that. Do you remember the movie Fifth Element?
Yeah.
But I think transportation, the day of getting on a train in like we do in New York or Washington, D.C., I think we're going to go into 2 pods, right? 2 or 3, or 4 pods for family. I do think it's going to change. I don't know how.
Yeah.
I think we just gotta sleep this one through. It's gonna be like Rumpelstiltskin, right? We're gonna wake up and go outside one day, and wow,
It goes on with everyone is dreaming what's happening, and it's difficult to inculcate. And every day we have to follow some patterns, and we'll try to do something new. But because of those news flooding around for the coronavirus, what's happening in US, in China, in India, Japan, and all those things, which makes us really sick in terms of just waiting and waiting and waiting. That is what we have to follow at this point of time.
Meanwhile, we all should just take, your way of doing things and Sasha's way, relax, enjoy your time at home, play some chess, pray, do yoga, get healthy. Maybe we'll get into some challenges and do more healthy things. Wednesday nights, I think IBM TV has a fitness night now. I've been getting invites. So every Wednesday night, we have a fitness night where somebody's on and talking about getting fit. And we've got a music cafe starting not this Sunday. Today is Alexandra's party. Happy birthday, Alexandra. But yeah, there we go. Alexandra's Musical Cafe. So we're going to bring some music, which is healing. I think we're just going to have to learn how to beam in and out like we do here. That's how we're going to travel. And if I want to come to India, I'll just beam in and out like Nick does.
That's what I was teaching Harish backstage, that how to beam in and beam out, because he was having a tough time entering the studio. But we need to, we need to share the best practices. Then only people will understand and use the technology.
I mean, speaking of best practices, if you guys watch how stupid our president is, they host these, they tell us all social distancing, and then they hold these press conferences where they're like crammed in and holding them and touching each other and moving it. And I'm watching this and I'm like, why aren't they doing this? This is free. If you go to meeting, this is free.
Yeah.
But
they have so much of money, they can use it as well. I mean, it's not about free thing, but I don't know why because in India, all those press conferences, whether it's happening to the president level, prime minister level, CM level, or maybe a junior level, everyone is following the digital platform.
Yeah, everybody, every other country is except us. And here's what's funny to me is, I had to ask Nick, I go, do they really maybe have a vaccine and they just haven't told us and they're waiting, or did they get blessed by a special holy water that in a church, which we weren't supposed to go to church, right? But here's what's funny. Our people like their churches so much, they don't realize God is in here. Our people like church so much that they're angry because they won't let us do drive-through church. I'm serious. They all want to go to a parking lot, like a drive-in movie. I don't know if you remember those, right? They want to go park in the church parking lot and have church in the church parking lot. And I'm like, okay, I'm sorry. I would rather do church like this, sit at my home, not waste gas, not risk getting contaminated by accident. So there's got to be a little common sense somewhere. But, in religion, I believe that if you truly believe in whoever your power of be is, they're not in a building, they're here. And
it's right here.
Yeah, it's right here. It's right here. It's right here, people. It's, you don't have to go to a building or a church. Pastors are great. I'm not going to discredit them. Priests are great. I'm not going to credit them because we need somebody to help us establish our faith and our prayers, and I think that there are a purpose for them. I kind of gave up religions a long time ago, but I never gave up my faith, if that makes any sense. I believe that there is a superior being. I feel like I've seen him or her, and I feel it here. But people, you don't have to get that feeling in a parking lot or at a church.
Sort of take picture.
Right. It's here. It's and I think that those preachers who are influencing this movement are wrong. And I think that you'll get a bigger following and probably bigger donations if people stay home. And like Nick goes to online church. Dr. Yu does online church. It's just to me, this is my online church.
For us, basically, if we are helping people in and out on daily basis, and during this pandemic, or maybe apart from that, that is what humanity is, and that is what the God gave us to help each other. And I think everyone would agree that the first quality which you teach or taught to your children is sharing is caring, and we are not doing it at this point of time. I don't know why.
That's just weird.
So it's not just about putting your attendance that I have visited the church, and that means you get some good qualities. It's about feeling from here, and then trying to do the best you can, because that's what the God wanted, to help each other and sustain a good living.
Kim, by the way, a great concept of drive-through church. You know what? You built a giant structure with 8 windows. So you drive in the middle, and there is a priest, there is a rabbi, there is a Italian, there is a pope, there is a Buddhist monk, there is a Indian monk, and Confucian monk, and you choose whatever you like. You just go through and stop where you need to stop. Okay, you got your service. Next.
I love it. It's kind of like the beer barns that we used to have, drive-through beer barns, and you just drive through and get the kind that you like and move on, right? Get the blessing you need and keep going. I love it. And throw in a McDonald's at the end of it.
Yeah.
That's something else we got to get over, and I think that's what Corona has really nipped us in the bud. Is all of our takeout food, right? And because I told somebody, I don't want somebody preparing my food right now. I don't want a restaurant, and I think we need to get back to some reality. And I don't want to be cooking my own food either. No, I'm just kidding. I can make a good peanut butter sandwich. So, but something I want to share with you guys. I know it's about time to wrap up, and I'll share it on Facebook. There's a doctor out there in the UK that was showing people how to breathe, especially if you get the COVID-19. He is showing how to breathe with all the pain that you're going to be having with it. And he said it's actually good breathing practices to do if you don't have COVID-19, to get in that practice so that if you do have it, you'll be in that practice. You're not having to fight. But he said these are great practices to keep your lung capacity up and strengthened, because that's what you're going to want to do. And there's something just, some of these things I think are kind of offbeat, but there was something real about what he was sharing. And I don't know why nobody else is. These are things we're asking, right? Is there something I can do? And to me, that is something we can do. Somebody keeps saying moist heat, moisture. They kept talking about moisture, but I have to agree with the doctor this morning. Our bodies are hot and moist anyway. So, and it grows in us. So I don't know if that's a good way to stop anything. I was always taught that the hospitals are cold to keep the viruses away. So, but I don't know. It's time to wrap up. I will send this breathing exercise out on Facebook, and maybe we'll share it tomorrow. But thank you, Hank, for a great visit.
Thank you. Thank you, Harish Ji, and thank you, Sasha. So we'll have our ambassador's message before we...
हैंड होकर और ऐसे अपने खांसी जब आएगी तो ऐसे करेंगे अच्छू अच्छू और कोरोना वायरस को धन्यवाद हमारा म्यूजिक सुनने का.
Bravo.
So that's the message from our ambassador. And thank you very much for joining us. And it was a great talk show with a lot of doctors and a lot of research people on board. And we're looking forward to see you soon tomorrow at same time. Thank you and take care and stay at home. Stay blessed. And it's time to wrap up.